And it is now 11 a.m. Mountain Time. And so I am going to go ahead and welcome everyone to this Public Health Disaster Research Award Program special webinar. And to begin, I'm going to go ahead and share my screen to share a few slides to formally welcome everyone. Okay. And Rachel, would you just come off mute really quickly to confirm that you are seeing my screen in full screen mode?
Yes, confirming, and also confirming that the closed captioning is working as well.
Very nice, thank you. So everyone, again, welcome to this webinar. My name is Lori Peak, and I serve as the director of the Natural Hazard Center at the University of Colorado Boulder. And it is my honor to welcome you to this webinar. And one of our core values at the Natural Hazard Center is to ensure that we always start and end with gratitude. And so in welcoming you all here today, we want to first and foremost thank you for being here. Thank you for carving this time out of your schedule, wherever you are in the world, whether it's morning, afternoon, evening, or very, very early morning in the case of our friends from Saipan. Thank you for being here with us. And we want to give special thanks to Robin Solar and Tracy Thomas and the Centers for Disease Control and Prevention and all of their colleagues here who from the beginning have helped to envision and support the program activities and the fundamental research and applications that you're going to learn about today. We also want to thank our program officers at the National Science Foundation and give special thanks to the team at the Natural Hazard Center. Almost every single person at the Natural Hazard Center has contributed to the various activities that you're going to learn about today, from preparing the program proposal call to reviewing proposals to reviewing reports, meeting with authors, and engaging in other activities. And so thanking all members of our research team, and a special thanks to Jennifer Tobin, who administers the various award programs, and Rachel Adams and Megan Morty, who have taken the reins with administering the Public Health Disaster Research Award Program with such intelligence and grace. And so a virtual round of applause, and I hope some thanks will go in the chat for Rachel and Megan for all that they have done. And I know they have met with many of you on many different occasions to help advance the research we're going to hear about today. And last, but certainly not least, we want to uplift and acknowledge the incredible investigators who are on this webinar today, who are going to be presenting their research that we're going to hear more about in a moment. So part of my role today is to give a brief overview of sort of the what of the Public Health Disaster Research Award Program. And then I'm going to turn over the microphone to Dr. Robin Solar of the CDC, and she's going to talk more about the why, the vision that has really driven this program from the start. And so I want to begin by saying that this really is a distinct academic federal collaboration that has resulted in this Public Health Disaster Research Award Program, which was established in 2020. And from the beginning, this program has really been driven by 4 core objectives that are at the heart. They are the pillars of what we do that uphold all other efforts. And so those 4 program objectives include teach, train, and mentor a diverse next generation of researchers and practitioners in the public health disaster research space, with a focus on students, early career scholars, and others who we're hoping to cultivate as the next generation of leaders in this field. Second objective, to advance novel public health and interdisciplinary research related to enhancing disaster preparedness, response, and community resilience in historically understudied areas. Number 3, this program is about building equitable, sustainable collaborations and connections between researchers and public health practitioners, community leaders and advocates and others who are working on the ground in communities at risk and disaster affected areas. And then fourth pillar of this program is to ensure that the knowledge that is produced is translated and moved into action through not only the writing process, but also through the development of tools, policies, programs, databases, and other tangible deliverables that have come out of this program. So over the years, since 2020, the Natural Hazard Center, in close collaboration with the CDC, has issued 4 special calls for funding. So special call 1 focused on research in the US territories, special call 2 on strengthening community resilience in the US territories. The 2 calls that you're going to have the opportunity to learn about today, the special calls were issued in 2022. The work was carried out through the 2022-2023 year. With special call 3 that again focused on supporting research in the US territories, but also expanded to other historically underserved areas, including tribal areas as well as rural communities. We also, for the first time ever, issued what we came to call continuation awards that were only open to special call 1 and 2 award recipients. And these continuation awards were in recognition of, we know that 1 year is oftentimes not enough. So this provided an additional year of support to either extend research or to engage in a deeper community engaged project or training or other activity. So over the 3 years of this program, over $1.1 million have been directly distributed to researchers. The program has funded 40 proposals, 153 investigators from 98 separate institutions, many of them located in these historically underserved and understudied areas, such as the 5 inhabited US territories. So just briefly, how does this work in a year? We're now at phase 4, the findings dissemination. How did the incredible researchers on this call actually do this? So during phase 1, which stretches across about 2 to 3 months, this is the proposal selection and funding stage. We release the call for proposals with the focal areas and the geographic regions of interest. The teams review the proposals, awardees are announced, awardees go on to ensure they have IRB proposal approval and so forth. Then in phase 2, which is really the heart of the research production effort, this is when researchers begin the research design, engage in collaboration to ensure they have the support they need, data collection, analysis. Then in phase 3, move into the report writing phase, because a published report is the primary output of this program, although as we've recently learned from a formal evaluation, all these teams are doing so much more than the reports you're going to hear about today. And then in phase 4, we have this public webinar, we release the reports, and then again, as we know, these teams go on to do great things above and beyond the report. So I hope during the Q&A today, you might have time to ask some of the researchers about those great things they're doing. Last slide, and then Robin, over to you. One of the things that really lies at the heart of this program is this recognition that understudied oftentimes equals underserved. And so one of the core goals of this program is to ensure that areas that are oftentimes hard hit by repeated, compounding, cascading disasters have the opportunity and the funding available to advance novel research on populations of interest, topics of interest, and then to have the time and the support to translate that research into action. And I am so excited to turn this over now to our colleagues at the Centers for Disease Control and Prevention, Robin Soler, who is going to give us some more background and context on this program and the vision motivating it. Robin, over to you with gratitude. Thank you.
Thank you so much. Tracy Thomas and I are incredibly appreciative of all the work that you've been doing. We are extremely grateful for the Natural Hazard Center and the partnership that we've developed over the years. And of course, to the National Science Foundation for allowing us to use this mechanism to advance the work that we're doing. So a number of years ago, before actually I started this position, Tracy and some of our other colleagues were working with the Natural Hazard Center, developing briefs and trainings, and really trying to help translate work and also to inform the development of the workforce. But as we kind of continued to do some of the research that we needed to do, and we really realized we didn't have enough people in the field to do public health preparedness and response research, and really like the converge concept that Lori was engaging in, and the mini grants that she was able to distribute on behalf of other agencies. And we thought we could kind of combine this need for expanding our field with the need to expand the knowledge in places that are understudied, and transparently places that are near and dear to my heart. My family, half of my family is Puerto Rican, and so we really wanted to make sure we were addressing those areas that were hardest hit multiple times and really not managed well and not understood well. So we started this program, and it's kind of morphed and grown into really making sure that we had advanced research and up and coming researchers who could understand public health implications of disaster research in a much better and stronger way. And it's become more and more formalized through the mentorship and the trainings that we've developed over the past 2 years. And so we're not just looking at you all for the fantastic research that you're able to do in your field and that you've been able to do for this program. We're looking at you for the work you'll be able to do in the future as public health disasters increase in frequency and intensity and in the devastation that they leave behind. And so there really is a lot of the motivation behind this program. Now, I want to say that I had the opportunity, back-to-back opportunities last month, which was just 3 days ago last month, to travel to the Natural Hazard Center conference. Tracy could not travel, but she participated some by on the phone, but I got to meet a lot of you. Thank you. And I'm sorry I didn't know all of your work, but I met people in the airport and all kinds of things. It was great. Mary met, she was like, "You're Robin." I was like, "I am. Who are you? I'm sorry." And then I actually had an opportunity to travel to Puerto Rico and meet with Federico and his team and many other awardees there. And talking and listening to you, I was just so overwhelmed by, what you're able to accomplish, how much you really are engaged in your work in your communities and where the work is going for such small dollar amounts, because, we see a lot of money in the federal government, right? We've funded some really big things and really haven't had a whole lot of return. And we are just so pleased and astounded by the work that you're doing, how you're advancing as thinkers, you're advancing your students, you're advancing the field, and just so grateful and appreciative of that. And I'll tell you, one of the things that I told people at the table at the Natural Hazard Center conference is that, or workshop, I guess, is that you need to tell your story to other people who can help us get more funding. We can't advocate for ourselves for additional funding, but you can always write letters and share and really talk about the not just the impact that you've had with the small amount of money, but the huge need in your community, so that we can further support those in what we call times of peace, if there is such thing, and they call them blue skies now. Sky is kind of blue, but times of peace, and also during natural disasters. And it's not just about having the money to do the things that you need to do to answer the questions and provide the services, but to have the knowledge. So this is kind of like a combination of those things: to have the knowledge, to have the students who have the knowledge to increase that workforce. So I just wanted to put that out there and say that you also can tell your story, and you can also, try to get an increase of funding. Our program, we're going through 2 transitions right now. We were the Center for Preparedness and Response at the Centers for Disease Control and Prevention, and now we are the Office for Readiness and Response. Our focus is changing a little bit, and we're actually expanding by pulling in other response groups from within CDC. This is in response to the COVID-19 pandemic and a lot of the things that we learned. In addition, our program itself is funded through a fund that is called the Academic Center Fund. That fund has been increased by $1 million, but our mission has been completely redirected. And we are going to be funding regional centers who are going to be implementing and advancing the evidence base for state and local health departments. This work still fits. We still have convinced people that this work still fits within that, because we are first advancing the workforce that we need in order to support those regional centers and make sure that they are functioning and acting, but also because a lot of the work that you all are doing actually informs state and local health departments. And it's a lot of the recommendations that we give to you. If you want to know why, it's because it's our mission. So we'll say, go present, go partner with your state and local health department. You know, the folks in Puerto Rico who did all this amazing community communication work, you know, they had to share with their health departments that their messaging and the messaging of the media, you know, needed to work together better so that they had the right things going out. And we weren't just talking about, you know, that people were dying, but how to keep people alive, right? So these kinds of things are really what we're all about. So please use your voice, not just to publish academic papers, not just to go to conferences, and not just to preach to your choir, but to make sure that there's additional funding out there. So again, on behalf of Tracy and myself, I want to thank you all for the amazing work that you've done. We really look forward to hearing your presentations. We have had a few ideas pitched to us recently from some of you all. I really thank you and appreciate you sending those ideas to us. I am reading them and thinking about them. I am sorry if we have not responded. We're incredibly busy. If you would like to communicate with us, I ask that you wait until after October 1st. And then we can share, talk, and think, and you know, seek out other connections within our agency to help advance your needs and your mission as well. So thank you very much, and I'll pass it back on to Lori. And again, this was on behalf of Tracy and myself. She really is kind of like the brains behind the continuation of this program throughout the year. She wanted to make sure that I had an opportunity to speak about the vision. So thank you.
Thank you, Robin, and thank you, Tracy, for everything you do, seen and unseen, that has gotten us to this day. So thank you both, and thank you for being front and center here to hear this incredible work. And so now we're passing this over to Rachel Adams, who is going to tell us, how is this going to work today, Dr. Adams?
Thank you, Lori. And thank you also, Robin and Tracy, so much for your continued support. So we are a lot of people today. We are currently 76 people on the call. And so in order to be able to hear from you all about your projects, we will be breaking up into 4 breakout rooms. And so the first breakout room is focusing on public health tools for emergency preparedness and response. The second breakout room focuses on building capacity to strengthen community resilience. The third breakout room focuses on extending public health disaster research in the U.S. territories. And the fourth breakout room focuses on expanding community engagement and research applications in the U.S. territories. So right now, you should have been prompted to join a breakout room, and you'll have the 4 breakout rooms listed. So you will actually go and join the room that either you are presenting in or your team is presenting in, or if you're just here to listen in and learn about these various projects, please feel free to join whichever room sounds the most interesting to you that aligns with your research areas. If you look into the chat, Megan actually just put in the link to our schedule. So you'll have a list of all the presentations there. She's put it in again, so you can choose. Or at least go and check and see which room that you should be joining for this next segment of the presentation of today's call.
Okay, good afternoon, everyone. I'll kick off this session by giving us a brief overview of our project entitled A Public Health Computer Simulation Tool to Improve Disaster Preparedness in Rural Communities. It is a collaboration between the University of Nebraska Medical Center and the University of Tennessee in Knoxville. And we make up an interdisciplinary team of epidemiology and public health, engineering, nursing and health policy, data science, and geography. So the purpose of this project was to develop a computer simulation that provides an in-depth understanding of how rural disaster preparedness systems interact and improves response capabilities of their healthcare systems to natural hazard events. So we focused on 2 separate case studies. Both were flood events that had very different impacts and outcomes. The first one was a flood event in Nebraska in 2019. Nebraska experienced an inland flooding event that caused an estimated $10.9 billion in economic losses. This event impacted 84 counties. Most of them are classified as rural counties and resulted in 4 fatalities. The other event was a flash flooding event that occurred on August 21st, 2021, impacting Humphreys County, Tennessee. It was estimated to be the deadliest natural disaster in Tennessee's history and resulted in 20 to 22 fatalities. Our timeline is shown here and involved 3 separate tasks that Tom will talk about in a minute, and shows also when we conducted our stakeholder workshops. So briefly, what we hope to do with this project were to answer 3 research questions shown here. So the first one was, how do rural healthcare system components interact? So we really wanted to understand how, the public health preparedness, emergency management, emergency responders, healthcare systems interact during an event to respond to an event. And then we wanted to see if these interactions could be modeled in a multi-method computer simulation. And our third question, which we realized over the course of this project would really be after this project, we need to evaluate whether our computer simulation can actually be applied to improve rural system preparedness, system efficiency, and response. So really, we're focusing on the first 2 research questions here today. And Tom.
Thanks, Christina. So first, I should mention that all the heavy lifting was done by my colleagues on the engineering and computer science team, Dr. Liam Tran, who is the penultimate GIS whiz, Gerald Jones, who's was instrumental in doing the multi-method programming, which merges together a handful of techniques so we can optimize the approach, pick the right tool for the right job. And Scott Lawson, which will pull together the data. And of course, Tracy and Christina were the truthful lending ones that told us, no, you can't do it that way. That's not the real world. That's engineering. That's not applications. So as a first step, as Christina said, we had 3 tasks. The first task was to really size what it is that we're trying to do, get an understanding of what the problems were by talking to the stakeholders, which is a unique approach for us engineers to actually talk to people that are going to use it. And they helped a lot in defining the variables and the constraints that we have. We'll talk about that in a little bit. Then we went into this thing called hybrid and multi-method modeling, which is exactly what I said, where you have a toolkit and you pick out the best tool for the right job so that you can optimize what the approach is. And then we circled back and recalibrated or retune the model based on those 2 case studies that Christina was talking about. So when we look at the model, we have 5 different independent sections. So you can look at that as 5 independent clocks. They're all ticking, but interact with each other. So there's public health, population, healthcare system, emergency response, and the emergency management. And all those interact, run independently, but also interact. As part of that badge, we have inputs, which are resources, the lead time, which is the time that ahead of the actual event that you might have warning, how bad the disaster is, demographic data, we'll talk about that a bit, and response input. What was interesting were the variables, those things that you can change in the model. What's different about this model as compared to some of the other models that you might have seen is this is a dynamic model. You can actually change the model, twist the knobs, turn up the volume and turn down the volume, certain variables, to go ahead and see how that changes what the end state of the model is, which is what's the response of the healthcare system. Next slide, please. So here's some of the outputs. So what we looked at, we needed units of measure. So we looked at rescue wait times, treatment wait times, injury, and those others that you can see up there. As we tuned our model, turned one side up and turned one side down, you can see what the impact was of if you could improve your performance in certain areas. You can see that deaths went down a lot, almost 90%. Response times went down, which is a good thing. They got to people faster by almost 80%. Patient wait times in the healthcare system went down, and the condition of the patients was improved. Next slide, please. So what we did in order to get the size of the model is basically went from curve to curve. So we went from low to high. So we turned all those factors down. In other words, made it as bad as it could be. You can see what kind of impact that had. So in short, the emergency response needed was much higher, and the population that needed treatment was generally higher. And you can see where the two crossed. And this is in hours. So we planned 120 hours. So it was the acute phase of an emergency event. You look on the right side, and all that happens very early within the first day. And so what it's really telling us is that if you can put this planning in place, if you can use a model like this to size your approach, the impact's going to be significant on the early end. Next step of this model is to see how you can, what those factors really are and how you can have those inputs in the model, which is why we created this as a dynamic model. Next slide, please. So these are some of the outputs that we have. We looked at deaths in the healthcare system, death outside of the healthcare, in shelters outside of the healthcare systems, number of people that you needed to get to. We also looked at impact on people that were impacted that had chronic diseases and what that might do to the healthcare status. Over on the right-hand side, you see the SDOH. So we looked at age ranges, ethnicity and racial groups, also health conditions. That's where the GIS really came into play. Not only did we see the flood impacts, but we saw what the impact was on the sociodemographics. And I think that's my part.
Thanks, Tom and Christina. So we feel that our study has implications for public health and emergency preparedness efforts. The study's simulation models have enhanced our understanding of how rural preparedness systems interact to prepare for and respond to natural hazards and catastrophic events. And as a result of our study, we've created a public health simulation tool that we anticipate communities using in their preparedness plans, activities, and resource allocation. Next slide, please. Namely, our study integrates first the different components of natural hazard preparedness and response systems, including public health, healthcare, emergency response, and emergency management, as Tom and Christina described. Second, the important key inputs that affect disaster response capacity in a given community. And these include communications, experience, and trust, just to name a few. And third, we felt like the study integrated characteristics of natural hazard itself and the community impacted to understand the effort or the effects of these components on disaster response in the rural communities, as you'll see on the next slide. And our public health simulation tool includes user adjustable inputs like Tom was describing. Here you can see that these inputs include trust, resilience, communication, preparation, relationships, experience, demographics, response inputs, resources, disaster severity, and lead time. And by adjusting the inputs, the tool can be used to test existing policies and procedures, determine how to best use existing resources, and identify where added resources are needed and how these will impact other areas of the healthcare system. And we plan to develop the public-facing tool even further with our future research. And I'll turn it back over to Christina.
So as Tracy mentioned, we do have some plans for next steps with this. One of our goals will be to expand the simulation to include other natural hazards, so not just focusing on flooding, and a longer time frame of impact after the hazard occurs. And then create that public-facing tool that can be used by rural planners and practitioners involved in disaster preparedness and response. We thank the Natural Hazard Center for the funding and support for this project, and also our stakeholders who participated with us multiple times in developing and providing us key input into our simulation. Thank you.
Thank you so much. And you guys are good for timing. 1 second, let me just unpin you, and then I will introduce our next group. Okay. So next, we will be hearing from Steep Risks, Assessing Social Vulnerability to Landslides in Rural Puerto Rico. I believe we'll be hearing from Jocelyn. Great.
And to unmute there. Okay, are you seeing it in full screen?
Yes, it looks great.
Great. Hi, everyone. As Rachel said, I'll be presenting on our project, which I tried to come up with a more creative title for, Steep Risks, Assessing Social Vulnerability to Landslides in Rural Puerto Rico. And I'm representing work done by my team, so including myself, Jocelyn West, Luis Alexis Rodriguez Cruz, who was representing the USDA Caribbean Climate Hub at the U.S. Forest Service during part of this project, and is now an independent researcher in Puerto Rico, and Stephen Hughes, who's a landslide geologist at the University of Puerto Rico, Mayagüez, as well as many of his students involved with landslide research at the university. We will move. Okay, so here I've kind of combined the purpose of our study with the research questions that we were interested in investigating. So this study assesses the social vulnerability of landslide-prone communities in Puerto Rico with the goal of understanding first the total population living in these areas, because that number was not well constrained before this study. Then we wanted to understand the relationship between social vulnerability and landslide susceptibility. And then we also wanted to understand how communities experience and define their own vulnerability to landslides, hopefully then re-inform quantitative measures of social vulnerability. So a lot of our field research was focused in Utuado, Puerto Rico, and some surrounding areas, which are all mountain communities. And the timeline started with the quantitative component of this research in the fall into January, where we analyzed the population exposed to high levels of landslide susceptibility, and then moved into qualitative research that was really concentrated in February of this year. And then some of the qualitative research and analysis is ongoing. Just for some context, I think this is an important way to introduce our motivation for working on this topic. So after Hurricane Maria in 2017, heavy rainfall triggered more than 70,000 landslides across Puerto Rico. And our collaborator, Stephen Hughes, and his team of students at the University of Puerto Rico, Mayagüez, did the very critical research to count every single one of those landslides from a combination of satellite imagery and intensive field work. But that's just the scale of this issue, and thousands of landslides occur on a yearly basis in Puerto Rico. So our research had a mixed methods design. So as I've mentioned, we started with a quantitative geospatial analysis of the population exposed to different levels of landslide susceptibility. And this was based on pre-existing work done by Stephen Hughes and Bill Schultz to create a really high resolution landslide susceptibility map for Puerto Rico, which you can see on the right-hand side here. So the levels range from low, medium, high, very high, and extreme levels of susceptibility. So that's just a measure of the physical hazard. And we wanted to combine that with the highest resolution population data set available to us to try to get a better estimate of how many people are really living with this hazard day to day. And then we compared that landslide susceptibility map with the CDC's social vulnerability index at the census tract scale. And we also complemented that with qualitative research in Utuado, which is located approximately where this black dot is in the upper map on the right. And that included 2 focus group discussions and 11 semi-structured interviews for a total of 33 participants, which include both residents of landslide affected areas, as well as service providers that include public health workers, emergency managers, and agronomists or other people involved with the agricultural sector. I just wanted to put a note in here about the use of focus groups in disaster research, which we found to be pretty successful for discussing this topic. We were inspired to use this method by the work of Lori Peak and Alice Fothergill and their use of focus groups with children after Hurricane Katrina. I just wanted to mention that we received very positive feedback from our focus group participants who found the actual exercise of having that conversation with other people who live in their area helpful and informative for them, as well as providing important information for us in this research project. So some of our preliminary findings from the quantitative analysis show that approximately 1/3 of the population of Puerto Rico lives in areas of high to extreme landslide susceptibility. So that's sort of these top 3 levels. And for me, that category indicates these are the populations we would want to make sure we're communicating risk to and doing outreach with, hopefully in blue sky times, but just on a regular basis in Puerto Rico. And then 6% of the population lives in the top 1% of areas susceptible to landslides. So that's the most extreme category. So it's 180,000 people is our best estimate of those living in the areas of most extreme risk. And the preliminary analysis of qualitative research findings, it's still ongoing, but these are some of our key findings at this point in the analysis. So we want to communicate through this work that landslides are a chronic stressor for some rural residents, and that theme came up repeatedly in our focus group discussions, that landslides are not just something that's a concern after hurricanes, but they also can be of concern anytime there's persistent heavy rainfall in the mountain communities. Many residents communicated that there's inadequate government attention to landslide hazards at all levels of government in Puerto Rico. And there's a desire for more attention to this hazard and to rural communities in general. Farmers and agricultural workers are a population who may be more exposed to landslide risk through impacts to their land and livelihoods on top of impacts to the communities that they live in. So for example, we heard from multiple farmers that after Hurricane Fiona, which just occurred in the fall of last year, many of them lost access to their property because of landslides or erosion on the one road in and out of their farm, and that caused them to lose entire harvests for that season, which is a significant economic loss, but also leads to food insecurity for those communities. Finally, elderly populations and people with disabilities were identified as being more vulnerable to public health impacts when landslides disrupt the road network. And then just on the right, this is a quote from one of our focus group participants. They said, "The landslides have not been fixed. The roads have not been fixed. Here we are still, as if hurricane season passed last month. And 2 or 3 months from now, the season will come again. And here there's no need for a hurricane. If it rains for 12 hours straight, the roads are gone and landslides are the order of the day. Because there is no planning, there is no maintenance of anything that exists." And so that was just emblematic of some frustration with the inadequate attention to a mitigation of landslide hazards, but also the idea that these are a chronic stressor in these communities. The public health implications, there are many, because landslides exacerbate public health concerns during and after intense storms in these areas. But the top ones that they exacerbate are related to clean water and then access to medical care through the road network. We want to highlight that communities with the highest landslide susceptibility are also typically medically underserved. So those two types of risk kind of compound each other during heavy rainfall events in Puerto Rico. And then some communities have started to self-organize ahead of heavy rainfall that might lead to landslides and isolation. And so we recommend that public health organizations could actually coordinate with these groups before and after disasters. So to say a little more about the public health implications, landslides, we heard over and over again in different conversations that they exacerbate or make public health concerns worse after heavy rainfall events. And so one of our recommendations is that supporting farmers and landowners in steep mountain communities to implement better erosion control practices can actually reduce landslide susceptibility, which benefits their livelihoods, but it also mitigates some of the public health impacts of landslides. And this little image here is just an example of vetiver, which is a kind of a grass-like plant that many people in Puerto Rico try to use to stabilize steep slopes, but more information is needed about some of the steps that can be taken to mitigate landslide hazards. Public health implication number 2 is that communities with the highest landslide susceptibility are also typically medically underserved. So this image here, it's work in progress, but is a screenshot from an interactive map tool that we're creating based on the results of this research that shows the combination of the landslide susceptibility map with the locations of public health or just health centers. So you can see that in the central mountain areas where there's more red and purple representing landslide risk. We also have far fewer red dots representing locations of health centers. And so it's, I think, important to the understanding of meeting the needs of these communities to understand that landslides and lack of public health resources kind of go hand in hand. Finally, our third public health implication is to know that some communities have started to self-organize ahead of landslides that could lead to isolation. And so public health organizations at various levels could try to coordinate with, support, and learn from these groups. One of these groups in particular was one of our collaborators and helped us organize a focus group for this project. And they consistently tie together the threads of agriculture, public health, and community education and outreach in their area. And some of the examples of this organization is that communities have created a very local census of some of the medication needs and pre-existing health conditions of the most vulnerable members of their communities so that they can try to get medications in advance of hurricanes and draw attention to those residents in the immediate aftermath of disasters. And this image here is just an example of a sign that we saw while driving around in Utuado that is actually calling attention to the electrical company, asking them to prioritize restoring energy to residents who are elderly and need service more rapidly than surrounding areas. So this is just one of the efforts that was like visible in the landscape that we were doing our work in. Finally, just some future directions. We have our forthcoming report on the Hazard Center website. We're doing continued outreach on this work with our research participants as well as the media. We're continuing to analyze the qualitative data. And one of the ideas proposed to us through some of our research participants is that there's a need for road network analysis to identify points where communities could become isolated due to landslides. So we want to identify communities that have only one road leading in or out, because those are the areas that we know could be isolated from emergency services or from medical services in the aftermath of hurricanes. Thank you. We just want to thank the many contributors to our work, including the Slides PR team at the University of Puerto Rico Mayagüez, as well as COSAL, which is the public health and local organization in Utuado, and the University of Puerto Rico Utuado for hosting some of our focus groups. And then thank you to all of our research participants and the Natural Hazard Center and the CDC. I'm done there. Thank you.
Thank you so much, Jocelyn. You were right on time. I didn't even have to interrupt you. That was a great presentation. Okay, great. So you stopped sharing your slides. So next, we will hear from resilience planning for climate influence hazards and health impacts for Virginia tribes.
Hello, how are you doing?
Great, how are you?
Good, thanks. I can share my screen here. Are you all able to see that?
It's
No,
currently
okay.
black on my
That's
screen.
okay. Give me 1 second here.
There you go.
How about now?
Yes, but if you want to put it
Okay,
in presenter view, it's like currently
for
in
sure.
notes. Yeah, there you go.
Okay, great. So my name's Jessie Palma. I'm here to talk about resilience planning for climate influenced hazards and health impacts for Virginia's tribes. I'm with Old Dominion University. The resilience planning framework used for this project is known as the RAFT, a Resilience Adaptation Feasibility Tool. The RAFT is a planning process that approaches community resilience holistically by considering environmental, social, and economic resilience. Community health is a dimension of the RAFT, focusing on physical and mental well-being and the provision of food, health, and medicine. The RAFT was developed by a leadership team from 3 universities, including the University of Virginia's Institute for Engagement and Negotiation, William & Mary's Virginia Coastal Policy Center, and Old Dominion University. 28 coastal localities in Virginia have used the RAFT to advance planning by identifying resilience gaps and progressing locality-centered goals ranging from flood mitigation to food and housing security since 2015. And so a one-size-fits-all approach to resilience planning and planning efforts may overlook the needs of certain underserved segments of the population, such as Indigenous peoples and tribal nations. These communities have often been excluded from planning and policy processes that affect them and their responses to climate impacts. Resilience processes have been tested with coastal tribes to address climate-influenced hazards, particularly flooding. However, these remain disconnected from health. Without tribe-centered holistic assessment, resilience goals and efforts are not reflective of tribes' experiences, capacities, and interests. This study adapts a tool for resilience assessment and resourcing and fills a gap in the literature linking existing priority setting strategies for environmental hazard mitigation with social determinants of health to improve resilience more holistically. Without a process specifically tailored to their needs, tribes do not receive the full benefit of the RAFT or any other resilience tools resilience building approach. By applying the RAFT process of resilience planning and implementation to tribal communities, an integration model was developed with tribes and the external partners they engage. They can address climate influence hazards and their health implications comprehensively. This study included the Upper Mattaponi Indian tribe, and they are one of Virginia's 7 federally recognized tribes, and the Mattaponi Indian tribe and reservation, one of the 4 tribes recognized by the state of Virginia, but not the federal government. Both tribes were involved in RAFT processes in some way prior to this project, whether through King William County or the Regional Resilience Equity Work Group. Both tribes are located adjacent to King William County, which is a coastal Virginia locality on the Mattaponi River that feeds to the Chesapeake Bay. The timeline that we worked with was We identified a tribal liaison, which we'll go into a little bit more in a second. And December, by February, we were conducting workshops with community members and developing checklists and agendas. And then the subsequent implementation process varied depending on what the goal was, anywhere from less than a year to over 3 years. And so our research questions. For tribal communities have their own unique circumstances, such as governance structures, land ownership arrangements, traditional land uses, and formal relationships with state and federal government. In order to develop that tribe-centered holistic planning process, we asked question 1, how can the RAF process be adapted to reflect tribe-centered health implications of climate influence hazards? And in order to develop a resilience building integration model for leveraging those partnerships, we had to ask, how can tribes leverage synergies between external partners and internal resources at the health hazards nexus to bolster resilience building efforts? The RAF process involves 3 steps. We have the assessment via a scorecard and qualitative interviews and focus groups. We have step 2, which is the development of a community-driven plan or the resilience action checklist. And third step is implementation of the plan. In a typical RAF process involving localities, the scorecard is completed by the RAF team based on public policy documents and qualitative interviews of community representatives. A report of the qualitative findings is shared with participants alongside the scorecard. Building off the resilience assessment, stakeholders come together in a planning workshop to co-produce a resilience action checklist, priority list that identifies 4 or 5 resilience priorities for the community to pursue. The RAP process has included citizens of neighboring tribes in developing the resilience action checklist and comprising the implementation teams for several coastal Virginia localities. However, for the RAP to be appropriate and useful for the tribes themselves, the process requires adaptation, including the scorecard and just the process in general has to be adapted to fit their cultural and infrastructure needs, their different governance needs. So the findings show that the resilience adaptation feasibility tool, or RAF tool, process does meet the needs of tribal communities with adjustments to account for institutional knowledge, governance structures, cultural interactions, and traditional planning timeframes. Some of the unique circumstances that required immediate adaptation in order for the process to work was working with a tribal liaison. It was very important. This adapted RAF process relied on liaisons to complete the initial assessment and agendas to recruit workshop participants and approve products so that researchers are not in contact with documents that are not a matter of public record, or making determinations about qualifications for workshop participants, or misrepresenting any sort of institutional knowledge. The tribal government issued a letter of support for the study, approving the liaison selection and the research process. The workshops were recorded, and any of the products or anything that was produced during the process is the respective property of those tribes. Another thing that was very important was incorporating traditional knowledge, inclusive language, the extending planning periods, because they do have to go through some of the federally recognized tribes do have to go through a Bureau of Indian Affairs to implement some traditional solutions. Because residents don't individually own the reservation land on which their home sits, loans to build or modify structures are limited as well, also causing an extended planning process. Let's see. Our public health implications, we only had 2 here, but the tribes have engaged in logic model informed processes to identify how traditional ecological knowledge would guide resilience strategies. However, the assessments have not examined health implications. With an emphasis on holistic planning, our study produced 2 public health implications. One, established an offering for a holistic health hazards resilience planning process through tribe-centered engagement. And 2, developed an integrative resilience building model that leverages tribal and external resources in the context of previous and existing efforts. That is a tribal resilience building integration model that highlights the role of health and complementing the tribal resilience efforts. This image here shows a copy of the scorecard totals for both tribes. And for each tribe, data was collected from an interview with 1 liaison and a workshop including up to 10 participants during the interview. Scorecards. During the interview, the liaison went through each element of the scorecard to revise the language and categories to account for tribal contexts, provided an initial score for applicable categories. Then we went back a second time with the participants that the liaison recruited and essentially went through the process again to get everyone's sort of comprehensive assessment, and made some changes to the language, some of the categories, and just the structure to account for the unique situations that they have going on. The same sort of semi-guided structured questions were used for each section as we went through together, covering areas of the scorecard missing or inadequately representing information, irrelevant areas or areas in need of alteration, gaps, and appropriate priorities and associated timelines. Sections of the scorecard were also modified to better reflect tribal culture and structure with an emphasis on cultural assets. This demonstrated priorities that were not just policy-based or infrastructural, but that they included human resources such as traditional knowledge holders or ecological knowledge holders. More cultural focus was added to the leadership, risk planning, and communities sections of the scorecard, and the language was changed to reflect that. And our second implication was developing an integrative resilience building model that leverages tribal and external resources in the context of previous and existing efforts. The various experiences and opportunities documented in the scorecard and checklist informed an integrated building model. This demonstrates how tribes, regardless of recognition or land utilization, can work toward a resilience hub. Resilience hub was a very repeated term and concept throughout this process. The figure 1 also ends with the establishment of a resilience hub that builds on unique contexts of the land and population. So as you can see, it begins with different partnerships, federal, state, or local, and the collective actions that they can work towards in order to provide tribal resources or find tribal resources, and then how those resources can be intertwined and used together to create a resilience building effort or a resilience hub. Oh, and it is important to notice that while some Virginia tribes choose to be added to the nearest planning district's hazard mitigation plans, others may not. Although requirements for planning do not apply to all tribes in the same way that they apply to localities, tribes adopting regional plans become eligible for Virginia's hazard mitigation grant program or other grant programs typically. The role of local, state, and federal partners in resourcing tribes varied based in part on recognition, whether they are state or federally recognized tribes, and recognition at the state level elevates tribal issues and expedites responses post-disaster, particularly when multiple jurisdictions, and there's they've called a state of emergency. And lastly here, this is a photo of the Hatchery and Marine Science Center for one of the tribes. And I'm just going to talk a little bit about the Resilience Hub and some of the ways that we've found that, because I'm assuming I'm probably coming up on time. Okay,
Yes.
well,
All right, you have 1 minute left.
Oh, okay, perfect. So participants identified synergies at the health hazard nexus between food security, mental health, and housing security. For example, participants identified the potential to translate mental health outreach by staff into hazard vulnerability assessments. Electricity and wireless internet projects were also identified as potential areas to integrate that would support hazardous conditions or just everyday sort of mental health and whatever needs that they may have. Expanding emergency alert systems and physical resilience hubs out of community centers offers opportunity for community cohesion and additional food, shelter, and water access during an emergency situation. I will fast forward here just so that I can acknowledge our supporters. We have the Environmental Resilience Institute at the University of Virginia, National Fish and Wildlife Foundation, NOAA, UVA School of Architecture, Virginia Coastal Zone Management, Virginia Environmental Endowment, and the Virginia Sea Grant. And just to, I know I'm done here, but the RAF team is exploring ways to facilitate implementation of the Resilience Action Checklist with the Upper Mattaponi and the Mattaponi tribes to support them going forward with their goals, and also to sort of assess the applicability of the RAF process with additional Virginia tribes.
Great. Thank you so much.
Thank you.
I see here, Nicole actually put in the chat a link to the scorecards and resilient action checklists for the tribes. So be sure to check that out. So our last presentation today, we will be hearing on validating the disaster food security scale for rural US populations. I believe, yeah, Nadia, you will be presenting. Yeah, that looks great. So yeah, if you want to go ahead and start and introduce yourself.
Sorry, I was speaking on mute.
Oh, okay. So yeah, I couldn't actually find you to pin you. Okay, there you go.
Yeah. Do you need to pin me or something? Can I start?
Yeah, you can go ahead. Thank you so much.
Okay, great. Great. So hi, everyone. It's great to see so many people here today. So I'm excited to present about this skill that we've started to develop. So I'm Nadia Khairati. I will be your presenter. I am from the International Food Policy and Research Institute. So let's get right into it. Okay, so for the purpose of developing this scale, I will refer to the scale as the Disaster Food Security Scale, DFSS, throughout the next few slides for ease of presentation, but the meaning of the abbreviation is also at the bottom. So the purpose of this study or of the research that we were doing was to validate the DFSS for rural area residents in the US. In terms of research site, populations from rural areas were of interest to this project. So the rural area was operationalized using the National Center for Health Statistics Urban-Rural Classification Scheme for counties in 2013. That was published on the CDC website. And for the timeline, we collected data from the US population starting in December, and we began analyzing the data around April. That's when the data collection ended. The analysis for the scale and validation is actually still ongoing, and I'll cover what has been done already and what still remains to be completed in the next few minutes. So our research questions aimed at determining whether the DFSS was a structurally valid measure of the disaster food security construct, and whether there was a difference in the structure of the DFSS tool between the rural and non-rural areas. So we were aiming to understand whether the DFSS that we created for the general disaster affected population in AIM-1 differed by the type of population groups in terms of items used to create the scale. The third research question was whether the DFSS was also valid as a tool for measurement of disaster food security in rural areas. For this, we were interested to see if the scale was measuring the food security in disaster during disasters in rural areas. Slightly different questions. For the survey instruments, we used one designed based on the disaster food security framework. We presented that in our previous call, and more information is available in our report. So the disaster food security framework included 4 domains: accessibility, availability, acceptability, and agency. And adequacy and face validity of these questions were tested via mixed methods. So quantitatively through a survey with experts in disasters and experts in food security, and using interviews with participants having previous experience with disasters. So once these questions were developed, we conducted a survey among US households from the counties that have experienced disasters in the past 5 years. We set a geographic quota to ensure sufficient rural representation. So 377 households reported that they remembered a disaster event. And of these, only 104 were rural households. We then conducted a factor analysis on the scale items. We also conducted measurement invariance analysis to check the structure of the general scale and the rural scale. And finally, we ran some regressions to test the different types of validities for the rural scale. And this table presents our findings. So we had 15 questions that were meant to determine the construct of the DFSS, all of which were significant at a factor loading of more than 0.3. So again, these items were developed after discussions with people with disaster experience and experts. So because these all 15 items loaded at what we wanted, it implied that all of the 15 items are relevant to represent the disaster food security construct. And our scale represented a unidimensional construct, meaning that disaster food security could be measured by a single score, even though we had the 4 different domains from the framework. We also tried to reduce the number of items to make it more comprehensive and easier to use in disaster settings, because we don't want it to be a burden for respondents. So we considered only items that loaded at more than 0.5, so which were more correlated with the construct. And that process led to the exclusion of certain questions. As you can see here in bold, 4 of the questions were not as relevant when we reduced the number of items. So the items excluded here, though, may have implications for the rural setting. For example, physical barriers to food sources during times of flooding, or in the case of road closures due to structural damage in the built environment. But nevertheless, both the 15 and the 11 item scales were structurally valid measures of food security during disasters. This was also true for the rural setting, in that the items used to create the scale were actually representing what it was designed to measure. Here, the disaster food security. And we determined these through various quantitative measures or indicators, such as the comparative fit index, the square mean error, and so on. Again, these specific analytical methods are in the report that we submitted recently. And I will go over this very briefly. To determine the extent to which the scale is related to measures of other construct that can be expected, on theoretical grounds to be closely to the one measured by the chosen scale, we tested convergent validity. And we tested that with food assistance. And we saw that for people who needed food assistance, their disaster food security scale was higher. So those who scored higher on the scale were more likely to seek food assistance. That ensures that our scale is valid on one type of validity. We also saw that the scale was valid at the discriminant validity option. So discriminant validity refers to the extent to which the scale differs from other closely related constructs. And in this case, we tested that using water insufficiency. It has been shown in various settings that when people are food insecure, they also tend to be water insecure. And we saw that those who were in our study, we saw that those who were food insecure, those who scored higher on the disaster food security scale, were also more likely to be water insecure. The two things that we found the rural scale was not valid for was predictive validity and differentiation validity. There could be multiple reasons for that. We tested predictive validity, for example, with health status. So that may not be a construct that would necessarily be relevant for predictive validity, because predictive validity means the extent to which the scale is related to known related outcomes. And here, health status was assessed post-disaster, like 5 years later. So it may not be relevant, but we could use depression as a measure for predictive validity. And that is something that we have planned to use. We have that information, we need to run the analysis. Same thing for differentiation by known groups. We tested that with Hispanic ethnicity because we've seen that the Hispanic group tends to be more vulnerable, especially in disaster settings. But our sample for Hispanics was less than 5%, which may have led to not finding any association with our scale. We are also hoping in the next steps to have a larger sample size. So for the rural population, we only had 104 people, which is not a lot when you're trying to validate a scale. So we are hoping to be able to collect more data, and particularly among people who have recently experienced disasters. So our study looked at any time between now and the previous 5 years, but we are hoping to get more information with the recent disasters that have happened. So developing a scale specifically for disasters has a lot of health implications. We've only put 3 here just because of time. So the first implication is on monitoring and surveillance of food and nutrition security in disaster vulnerable and disaster affected areas. Tailoring interventions to address food systems limitations in rural areas and enhancing resilience of disaster vulnerable communities. So for our first public health implication, having a rural food security measurement tool can help to identify households or communities experiencing food insecurity over time, not necessarily just during the event, but also pre and post. By collecting accurate data on food availability, access, agency, and acceptability during those times, public health officials and policymakers can better understand the extent of the problem and target interventions and communities more effectively. That is, those who are most vulnerable. And tailoring interventions. So with a reliable measurement tool in place, again, public health authorities can tailor their interventions to address specific food security challenges that are faced by the rural populations. Now, this may include implementation of community-based programs, food assistance initiatives, or even agricultural development projects aimed at improving food access and availability, and also to target different domains of food security that are more problematic. For example, if agency is a problem for food security, for ensuring food security, effort can be made to consolidate the services such as electricity and water. Or if physical barriers are problems, then to ensure that, for example, roads are quickly made operational, or that people have transportation to reach the food sources, and so on. So the point is that the interventions that can be put in place don't always need to be financial, which is currently the case in many food insecure populations, but rather having this tool, the interventions can be adapted according to the needs of the rural communities, based specifically on which aspect of getting food is actually a problem. Enhancing resilience of disaster vulnerable communities. Having a food security measurement tool helps in identifying vulnerable communities that are at greater risk during natural disasters, economic downturns, or other crises. And understanding the specific challenges faced by these communities allows public health agencies to develop resilience building strategies, such as creating food reserves or implementing early warning systems and identifying bottlenecks in the rural food system that needs to be addressed for better protection in disaster events. So protection is better than cure, right? So we want the communities to be protected against food insecurity in disaster event times. And the data collected through this tool will offer an opportunity to address inequities and improve health outcomes. So to end, I would like to thank all of our partners from the different institutions that we have worked with and the Natural Hazards Center. Over to you, Rachel.
Thank you so much. Those have been really great, insightful presentations. And as I've been kind of posting into the chat, the link to all of the reports. I know some are still forthcoming, but most have been published on our site. So please do make sure to share those with your networks. So the remaining 8 minutes we have for Q&A. I know there have been some questions that have been posed in the chat, which, then people have gone in to answer, but kind of starting there, did anyone else want to elaborate more on kind of questions they had already placed in the chat or responses that they had provided?
I can elaborate more on a question I received from Diana, sorry. She asked about which social vulnerability measure we use specifically, and I kind of glossed over that in my presentation today, but we started by using just the standard published social vulnerability index from the CDC for Puerto Rico at the census tract scale. And we found that it was not actually correlated with landslide susceptibility at the census tract level in Puerto Rico. So that was kind of just a preliminary analysis to see, like, is there a relationship based on the way the scale, the social vulnerability index is currently constructed for Puerto Rico. And then what I hope that our research will eventually contribute to is creating a better SVI measure specific to landslides for Puerto Rico that might show some relationship between spatial units. Thanks.
Thank you so much, Jocelyn. And I know you also shared a couple of links in there as well to some scholarly papers on specifically that, the SVI in Puerto Rico.
Yes, I've done some work, and my colleagues have done work suggesting adaptations that can be made to the SVI for Puerto Rico to make it a more valid measure, but I think that work is ongoing and the CDC is supporting it, so that's exciting.
Oh, that's great.
I just want to add, thank you, Jocelyn, for your for your answer. And it's really neat that you're kind of working on the social vulnerability, improving the social vulnerability, because we did a study, and our study just showed that same result. There are still a lack of relation with, especially with transportation related network variables, which kind of align with your insights. I really loved kind of what you found out with the qualitative research, how it was confirmed people are really isolated, and that's the reality. I went through Tuaro. I did not do a focus group there, but I did go through Tuaro, and that the reality is that the roads on a normal basis are really, really harsh.
We saw that too. Thank you.
Thank you both. Are there any other questions for the different presentations and teams that you heard from today? If not, I do have a question for you all. Okay, so thank you again for all the great presentations. So one of the goals of the Public Health Disaster Research Award is to really plant the seed for future research, as well as partnerships and applications, as Robin had alluded to earlier. So in addition to the report that you all completed, can you share with us what next steps you have planned for additional work, and if any, perhaps related to this grant in terms of extending your research into another project or other grant applications?
I can go first.
Yep.
So for us, for the disaster food security scale, to truly validate it at the higher level, we are hoping to collect more data. So from even more recent disasters. We are also, I hope, given if we have funding, target different types of disasters. So at this time, the scale is designed for any type of disasters, but we need to validate it also for each specific disaster. So I'm hearing landslides. We also have snowstorms. So I'm from Buffalo, New York, and we had a snowstorm in December, and then again in November and January. So that was pretty bad. And that is also a form of disaster. We have flooding, we have drought. So we are hoping to get sufficient participation from these different types of disasters to validate that scale. And if that, it works for all the rural areas and all the types of disasters, then we have a consistent scale with the same items that can be distributed and perhaps be used in the food security surveillance system by the USDA. That's it for me.
Great, thank you. Would anyone else like to share how they're continuing their work?
I can be brief. I didn't mention at the beginning, I'm a PhD candidate in the sociology department at the University of Colorado Boulder. So this work has kind of been the seed research for my dissertation. And so we hope to kind of expand the effort. We're continuing interviews with some key informants that we've been referred to. We would also really like to do the road network analysis that I mentioned, that I think we have the data for. We just kind of need to allocate time to it. And then we have a lot of outreach planned with the communities that we did the work in, because that was a specific request in the focus groups, was that we return to the communities, present more information about landslide hazards in general and the results of this research. So we'll be doing that through the next year.
Great, thank you. And I saw, Jesse, that you had unmuted if you want to add on behalf of your team.
Sure, yeah. I know that we recently secured funding from a private foundation to test the applicability of the RAPT with 6 other federally recognized tribes. And I know that 4 of those are, they have preliminary meetings scheduled for September for next month, so.
Great, very exciting. I know we don't have a ton of time, but if Christina, I don't know if you wanted to add No?
I was just going to say that I said at the end of our presentation what our next steps were, and we've actually already started working on a website to make this a publicly available tool, so we can share that with you all when that's available.
Great. Well, thank you again, first and foremost, for the actual research that you've done and under such a compressed timeline, and all the things that make going out in the field challenging, and for today presenting on all of your findings and explaining the public health impact of your work. We're so appreciative, and please, keep an eye out on for potentially future funding opportunities, continuation awards, and all of that. And that concludes our session today. So take care, everyone, and thank you again.
Thank you.
Thanks, Rachel.
Thank you. Bye.
Bye.
Thank you very much, Laurie. Thank you very much, everyone, for coming to the presentation. Again, thank you very much, Laurie, for the opportunity, and again for the introduction. I think this will be a brilliant segue in terms of where this project is based out of. I hope my internet connection doesn't get patchy, because I am calling in from the rural northern India right now. So without further ado, our project is Energy Service Security for Public Health Resilience in Michigan Western Upper Peninsula. And I am one of the 4 team members. So Zoe Ketela, who was presented earlier on in previous meeting, and Chelsea is our advisor and colleague from Michigan Tech, and Eric was an undergraduate student who participated actively in this research project as well. So the first question which pops to our minds is like, where is Western Upper Peninsula of Michigan? So this is Michigan. It's next to Wisconsin, and like up north where you see this cursor, this whole area is called the Upper Peninsula of Michigan, because we are connected by a small bridge here called Mackinac Bridge. But in this peninsula, the top 6 counties, which are the insets here, are the Western Upper Peninsula counties of Michigan. And the main purpose of our research here was to examine the extent at which public health facilities in Western UP, as I would call Western Upper Peninsula of Michigan, are prepared to navigate energy service disruption. So we wanted to focus on energy service and energy service security, because we felt that is an important consideration when we talk about disaster and public health implications. And the reason we selected this particular region was, of course, because we all work and study at Michigan Tech. But apart from that, the region is historically, geographically, socially, and culturally very unique. So first, the historical part, it was a post-mining community up there. There was big copper and iron mines up in this part of the region. So now it's a very well defined post-mining community. It has a very well defined post-mining community structure. Geographically, it is at the tail end of the US infrastructure. Like after that, it's the Great Lakes region. There's Lake Superior, and then there is Canada. So there's only one way out from the tip of the peninsula here at Kavanaugh. Socially and culturally as well, because it is so far away from the capital of Michigan and the US in general. It has a very distinct way of life. And interestingly enough, we get every year over 300 inches of snow. So our focus, because of these peculiar conditions, the focus of our research was on disruptions that are caused by disasters, and how our public health facilities, and I'll use hospitals and health facilities synonymously here, are planning in terms of looking at on planning for disaster research from an energy service perspective. So this purpose of our research translated to 2 major research questions that we were looking at. So the first was to what extent are health facilities in the UP talking about on energy, modern energy and energy services, with a high, where we have a high likelihood of power system disruptions, particularly because it is tail into the infrastructure, and some of the points that I've already mentioned. And the second was, how can we evaluate the preparedness to inform decision making that can enhance this energy services? Because what we felt was that energy today forms the backbone of literally every sector. Like there is not even a single aspect of our life, modern life today, that we could live or be comfortable about without modern energy usage. And we are home to the tribal community as well. And so we were looking at from the both aspect, and that's how the research purpose translated into research question. And the methods that we utilized for our study, we used a mixed method modality. And the first part of it was semi-structured interview, qualitative interviews. We relied on snowball samplings for our two set of questions and also two sets of stakeholders. One set of stakeholders were the hospitals or the health facilities, as we call it, in each of the counties. And then we had our public health stakeholders from public health department, other trust, other organizations that are working in public health sector in the UP. The interesting thing about Western UP, apart from what I highlighted in research purpose as well, that Western Upper Peninsula Health Department has a public health department, which is known as WUPHD, Western Upper Peninsula Health Department, and it is also governed by Western Upper Peninsula Development Region from the Michigan State. So we did snowball sampling because we were looking for the experts, people who have worked in public health sector and in hospitals, because we were trying to understand how they are prepared and they think about energy.
Is frozen.
Sure. I was going to say, did Shardul, I think we lost your audio.
Audio on.
Oh no.
Lost his audio and his video.
Oh,
His video is frozen.
Let's see. Oh goodness. This is our disaster preparedness. We didn't have this. Oh, there we go. Okay, so now we lost Shardul completely. Oh no. Sorry, everybody on the line. Maybe I'll give this a second to see. And I can't go back in the main room.
He may be logging back in.
Okay. And then, yeah, he'd need to rejoin us. So maybe he was literally midpoint of his presentation, friends. So, maybe we'll give this a minute, and if he's not back in here, we will improvise. And
Lori, this is Chelsea. I'm
Oh,
just letting
Chelsea,
you know I'm here.
hi.
So I would totally be winging it, but I am happy to talk about the project in a very general sense without having Shardul's slides, if that's what we need to do.
Okay, Chelsea, again, disaster researchers are very resilient. So welcome. It's great to see you. And
it's nice to see you too. Hello, I'm on my phone. So I've been walking around with the webinar and I'm here on my phone. And as Shardul said, he is in rural northern India right now. It looks like he's joining. So I might see if his slides will work. But I do want you to know if that happens again, I can just jump in and tell you about our project in a very general sense.
Oh, Shardul has joined back.
Yes, I did jump in back. I think I dropped out of the connection somehow.
Great, take it away, Shardul. Thank you.
Thank you, Chelsea. Yes, so I'll try to make up the time. So we did a secondary. We did rely on survey as well, and this was only directed for the health facilities to look at what their energy service needs and their electricity needs are. So combine the predominant results that we see, that we developed 40 initial codes, and that got translated into 3 main categories, particularly energy service needs, risk and concerns of the public health stakeholders, and the provision of services, what kind of services that are available. And the major findings that we learned through this research project was the self-relying nature of the community, because it is at the tail end of energy infrastructure. It is far away from the center of Michigan. If in case of disaster, any natural disaster that has happened or climate-induced disaster that has happened, a community always think that we can deal with this on our own, because by the time the help or the support will come, we'll be able to fix it on ourselves. And this has serious public health implications in the long terms, particularly when we know that the intensity and the frequency of climate-induced disaster is going to increase in the near future. It also instead of focusing on just the results, I'll try to translate that into public health implications. So the first aspect of this is the heightened vulnerability to public health issues, particularly because of extreme weather. The demographics that we see here are old people, and the energy service infrastructure that we see is also aging in the grander scheme of things. Second is we have, as I outlined, we have a rural population that have even though, for example, some county headquarters might be called urban headquarters, they have a very lived rural experience, and that has public health implications as well. And the third point is, and this one it was a major one that we learned, is health facilities in Western Upper Peninsula of Michigan are looking at to cater the needs of people who are coming to hospitals. But what happens when in case there is a larger disaster, how will wider community energy service needs can be met from during that particular period? And I'll try to elaborate on these 3 points quickly. So first, because of the geography and rurality of the UP, there is an increased dependency on imported fuels. So even though health facilities have backup fuels and gas supply, that is still dependent on the fuel coming into the region, which is again imported from outside. The relationship between energy service and energy infrastructure, and its implication of public health is still understudied. So there is an understanding that we have backup electricity system and backup energy systems in place, but the importance and in case of cascading failure, how that will affect the needs of the community is still a bit uncertain. And the third point is, in case of disaster, for example, one of the health coordinators outlined to us, because we get over 300 inches of snow, snowmobiles, for example, are required in the winter to bring people to the health facilities, because particularly Keweenaw County and some of the counties are so far off. And that becomes challenging during long-term duration outage, particularly with patients that get medical care in-house or get in their homes. The other aspect is the older rural population and some extent tribal population as well. They experience real issues in terms of accessing the care, particularly during and after the disaster. Even though what we learned that there has not been a major energy failure due to a disaster in the near memory, and that has led to very limited proactive planning in terms of assessing the energy service needs of the community. And when we say energy service needs of the community, we mean going beyond the hospital needs, going beyond what electricity supply or what energy or fuel supply only hospital requires. In case of a energy system failure in the region, what happens to the people who are getting treatment in-house, or for example, are at dialysis, or the vaccine requirements for the region. So there is an immediate need in terms of quantifying the needs of the wider community in case of a prolonged disaster. The last, there is, and that's one of the major things that we want to pursue in the future as well, in terms of creating a proactive planning framework for local energy security, and looking at the cultural infrastructure and institutional dynamics that when comes together can exacerbate the vulnerabilities for public health, particularly in the Western UP. So this is a short, direct summary of the work that we have done. And again, sorry for the interruption. I'll be happy to take questions and talk in detail about any of the points that I've discussed. Thank you.
Thank you, Shardul. And even
I have a question.
hold on, Chris.
Okay.
Even with the time interruption, you still had 3 seconds remaining, and you rejoined from India. So Shardul, thank you. And Chris, one thing we are going to do, if you wouldn't, we're going to hold all questions until we've gone through all of the presentations.
Okay.
Just to make sure that we have time for everybody's presentation.
Everything. Yes,
But
yes,
Chris,
yes.
if you would like, or anybody on the call, if anybody has a question for Shardul that you don't want to lose, feel free to drop a little note in the chat. Shardul can respond, or we can just hold them for the end. So that's how we will proceed with questions.
Okay.
Good, Chris. Okay. All right. Perfect. And so thank you again, Shardul, for that really interesting presentation. I really appreciate how you spend the additional time on the public health implications with this. And so next up, we are going to hear Summer. I believe that you are again taking the reins with the presentation. Is this correct?
Yeah, that is correct. I'll be
Okay,
doing
so we'll go ahead
that.
and turn the capabilities over to you. Thank you.
Perfect. Let's see. Sorry, yeah. Computer. I have a new computer, so I wasn't anticipating the difficulty, but I think I got it. Okay, cool.
Summer, it is showing, there we go. It's in full screen mode and I'll start the timer now. Thank you.
Okay, perfect. All right, hello everybody. My name is Summer and I'm going to be representing to the best of my ability a lot of really wonderful people that are helping research and partner with this. Let's see, I don't know if this is in your guys' way, hopefully not. With this project on harmful algal blooms and community-based participatory research in order to improve rural public health practice. So this is the community we're working with. Lakeside has a population of less than 2,000 people. Historically, a lot of the economy was based on agriculture and lumbering in the region, but nowadays the main economic driver is tourism, and that is mainly like a huge draw to the lake as well. A lot of the residents of Lakeside get their water from a lake not depicted. It's north of this image, but over a fourth of the residents actually are left on their own to get water supply directly from the lake or from well water. As they are spread out along the various different arms of this lake, you can see all the little blue boxes we have here that is depicting some of those members. As you can see, the water looks a little green, and that is due to the fact that in the winter times, there's a lot of nutrient loading in the winter of cyanobacteria that loads into the water, and then in the hotter months, they can turn into harmful algae blooms that make the water a visible green, as you can see, and can be harmful for both humans and animals to consume. And as people both live off the lake and recreate on it, etc., the Oregon Health Authority recommends people to not recreate and use this water into proper filtration during the times of maximum algal bloom. But the guidance is not very consistent. It can be pretty contradicting, and due to the low population density of this region, a lot of the messaging is not getting out to all these individuals. So we anticipate that a lot of people in rural communities like this region are encountering similar problems. And so we're aiming to address that in our project. So our main purpose, hopefully, is to understand how freshwater cyanobacterial harmful algal blooms affect health and well-being in rural communities that face these decreased public water infrastructure availabilities and also do not have the same amount of surveillance of cyanobacterial hazards as more populated areas. And we also aim to ascertain the disparate public health practice challenges, and in order to improve these hazardous events and their preparedness for these rural communities. In this specific research site, as I said, the algal blooms, which is the visual proliferation of these cyanobacteria, these result from nutrient loading, and they can actually be exacerbated with human interaction and also climatic concerns such as rising global temperatures. So this is going to be an even increased problem, and it is kind of unpredictable from year to year how this will affect these communities. You may have heard of some instances in places such as Toledo, Ohio, or Salem, Oregon, where larger populations had their water supplies compromised by cyanobacterial harmful algal blooms. And in both situations, the National Guard had to step in and distribute bottled water and people were largely left on their own. And this infrastructure is even weaker in rural communities, such as Lakeside. And then what's more, Lakeside and other rural communities, these waters are often going untested, which is a bigger problem as well because these communities are increasingly reliant on the lakes for more than just recreation. It's the main driver of their economy as well, as I addressed. So we're partnering with this community in order to better understand this. Our main questions are, how do Lakeside residents perceive their health and well-being and the risk to that? And what views do they have about, sorry, this is a little bit blocked. Oops. And so what views do they have about how health agencies have been reacting and monitoring the lake water? So how are people thinking about this? And secondly, what is the actual health risk? So how are these people expected to use the water, both domestically for consumption and recreating on this? Thirdly, what do 10 Mile Lake residents recommend that public health agencies do to improve the monitoring and guidance in the area? So as you can see here, we have a beautiful little depiction of our methods, but it did not always start out like this. We originally intended on getting a broader picture of the situation in the area from doing surveys and focus group discussions, but we actually encountered a lot of suspicion and resistance in the community due to just a more politicized public health environment. So we were able to, in collaboration with meetings facilitated by the 10 Mile Lake Basin Partnership, have meetings that were unscripted, unrecorded, to really get a better picture of how these individuals were feeling. What were their questions? We shifted the focus to what would be most beneficial for this community. And then we were able to design this structure where we were able to train citizen scientists beginning in March where the low risks of hazards were. And then as the year is progressing, we were including surveys and focus group discussions in the community. As I emphasize, the backbone of this project is really the citizen scientists. We were able to train them, and bi-weekly, especially in the high-risk seasons, they're able to take samples of where the water is being pulled from the lake, and then also after their treatment systems to really get an idea of how effective these systems are. Preliminarily, we were able to find once again that high distrust for federal, state, and local public health agencies because of a lot of conflicting messaging over the years and lack of transparency. I mean, it makes sense that people kind of left to themselves are having a great sense of independence. But through open and transparent discussion, real concerns and vulnerabilities were able to emerge. Concerns such as with drinking water, people concerned with how their kids' health is going to be impacted by this drinking water, financial burdens on families having to import water from different locations, and then economic burdens on the communities where it's affecting businesses' bottom lines, increased costs for residencies, animal health, and pets drinking this water is also a big concern. And also recreational activity, people being concerned that they're not going to be able to use the lake and use their surroundings in the way that they moved there, intending to be able to do. And then having unpredictability in that use, as it's been shown to change from year to year and even within that year. So also in September of 2022, we were able to find that 4 out of 7 surface water samples were testing positive for microcystins, just over half, and is a concern because this would go over several different guidelines for use for potable water. And what's more, this differs both based on space and time. So on different, especially on the openings of the arms of the lake, the microcystins tend to congregate there more severely, and a lot of people live there. So how, and then also a saying in Lakeside is that talking about the lake is talking about the weather. So just like the weather, this might change within the day as well as within the month. So there's a lot of things to consider, and there's obvious that visitors as well as residents, both permanent and transient, require better guidance in the risk in drinking this water. Public health implications include that these rural communities have unique challenges, and that these communities each need a specifically tailored reaction to these problems, and they must be addressed within both the local natural and the cultural resource context. And that public health efforts should develop local partnerships in order to better embody trusts and collaboration with the community, because only then are you able to have a truly successful and meaningful and lasting impact on the community. And there's also a need for increased guidance for households who are not only left on their own to provide for themselves, but also left on their own with what is actually going to be working for me. The messaging also needs to be improved because there's a lot of transient folks and newcomers and seasonal residents. So there's a lot of need for better communication and guidance. We're further emphasizing with this that a bottom-up grassroots type approach was way more successful and able to better motivate the community into wanting to be involved than more of a top-down approach. And then we wanted to further emphasize that, as well as the fact that filtration is actually a very intensive process. It's not only very expensive, with each filter costing like hundreds of dollars. As you can see here, there's a carbon filter and UV filters that are depicted, but many of these residents have several of these systems, all in different combinations with different effectiveness. Some of these systems are chlorinated and very intensive and kind of harmful for someone to be having to go in and change every month. So we are luckily collaborating with a lot of people who have these resources to be able to test the efficacy of these filters, but it's also important to note that not all individuals might have access to these filters, or not even have information that they should be filtering it to this extent. And important to note that it's not just a matter of boiling the water and it'll be fine, as I'm sure you've kind of gotten the gist of, because boiling can actually just serve to concentrate the toxin. Same goes for if you have the filtration in the wrong order. So ultimately, guidance is very, very needed in this community. And we're excited as the high season of, well, I guess not excited for harmful algal blooms, but excited to learn more about this year and how effective these filtration methods are for these communities. And we are actively communicating with them as this year goes on. So again, this is an ongoing project. So thank you very much to everybody. Lori Peak, thank you for the 10 Miles Lake Space and Partnership and those members there. And if you have any questions, feel free to drop them in the comments section. Thank you so much.
Thank you, Summer, very much for that presentation and for the work that you and the team you are a part of have been doing, and the deep community collaborations you've been building in these rural communities. So thank you. And next up, I see Pallav has already come off mute. He is ready to go. And so if you would like to go ahead and share your screen and introduce your project and your team, we're excited to hear from you and great to see you as well.
Great. Thank you, Laurie, and thank you so much for your support and your whole team. And I couldn't describe any more way that the outstanding support that we got throughout the projects, and couldn't do it without that types of active engagement and so on. So let's in the interest of time, let's jump into our research project. And everybody, thank you so much for the opportunity to present our work. We had an excellent team for this project. I'm Pallav Mazumdar. I'm a professor at Florida International University in Miami, Florida. And we had Lynette from University of Puerto Rico. We had Myra from the Medical Administration Service in San Juan, Puerto Rico. We had Barsha from Florida International University, and then CC Mang from the Notre Dame, University of Notre Dame, and Nafisa Halim from the Global Health, Boston University. So we had an excellent skill set to pull these projects, and our main focus, as you can see from this picture, actually try to figure out a way to understand the extensive Hurricane Maria aftermath impacts in Puerto Rico in terms of mortality and morbidity outcomes. So our project focuses on assessing the health impacts with a specific focus on how do we build some resilience in the system, so we can reduce these types of impacts for the future. So that's our objective. I don't know why it's not moving. Give me a second. Stop share and then reshare.
Is it not advancing, Pallav?
Yes, okay, good. So I think, yeah, I'll just use this sidebar to
Okay, that's totally good. Thank you.
Okay, so the again, as we described, the purpose is to get an understanding, deeper understanding of the unique challenges in the Puerto Rican context in the aftermath of Hurricane Maria. But one specific, we would say, unique way of looking into this, we'd like to divide these challenges into several boxes. We are thinking, in terms of resource constraints, financial, human, technical constraints. We'd like to box other challenges into management constraints, the practice, and so on, and then policy constraints. Our understanding, if we can box them up into these categories, some of these constraints may not be mutually exclusive. We understand they overlap with each other, but at the same time, we think, boxing them, disaggregating them into these categories will help us to identify action items, priority items, which can be solved readily, which can be intervened readily, which can be short-term, suitable for short-term intervention, which are for much more longer-term intervention, and who are the partners, who are the movers and shakers to make those changes, and so on. So we did surveys and interviews. Our research method primarily, we try to reach out, different stakeholders, patients, nonprofit organizations, public health professionals, doctors, nurses, pharmacists, hospital utility service operators who run generators, water systems, and other things, and so on, hospital management personnel, and some other relevant, key informants. We are in the proposal writing, we are a bit ambitious, but at the end, when we hit the ground reality, we ended up with, our sample size was 62 interviews, but I thought, we thought, we had enough information to make some, recommendation and so on. And we saw, like, at the end, we are getting a lot of repetitive information. So we thought, in terms of the information we received through these samples, we feel good about it. And we did make, effort to cover as much territory we could. But as you can see, most of the people, most of the facilities are concentrated in San Juan. And that's where most of the interviews, but we also, try to collect this information throughout the islands. And this picture will give you a little bit of, a snapshot of the different types of stakeholders that we interviewed. As you can see, the nurses are the major category in our sample. And actually that gave us a lot of insights, because in the whole healthcare providing system, nurse plays a very instrumental roles. And actually that their information and insight was very eye-catching for us in this project. So this gives you a breakdown of our different stakeholders. This also gives a range of experience they have in the profession. As you can see, most of our, respondents have great deal of experience in providing cares and so on and so forth. So we are confident that the information we are getting from them, their insights, their ideas, their thought process is very valuable in this project. So as we mentioned, we are our primary goal was to analyze these challenges, understanding the challenges in some sort of a disaggregated fashion. Can we box them up into different types of constraints? And so we, in the survey process, we are designed very specific questions, how they see those different types of challenges, and can they rank them in terms of the developing resilience in the system, overcoming these kind of challenges, and so on. I will give you a snapshot. We don't have that time to go in details, but you can see, for example, lack of resources. We asked them, to rank them. Do they think it's all of it lack of resources, most of it, some of it, and so on? And we provide detailed discussion on these things in our report, and so on. And you can see management practice. We try to disaggregate them into healthcare system, management in the healthcare system, management in the insurance systems. Then we also look into the different policy constraints and similar types of disaggregation. We ask them, how they think about its role in causing these types of catastrophic outcome in the aftermath of Hurricane Maria and so on. So they gave us some, and we are able to, dissect those information and make some recommendations and summarize the findings. So our main finding that, it was primarily driven by resource constraint, the morbidity and mortality are extreme, following these extreme events, but it has been exacerbated by management practices and policy constraints. So that's our primary findings. And we did both, structured, semi-structured, so both qualitative and quantitative findings did confirm that, that we had, from the supply side, healthcare facility side, the challenges they had due to disruptions, due to human resources, and on the demand side, from the patient side, their access issues and, reaching healthcare facilities, finding doctors, nurses, and so on. All these things in combination produce this outcome. So in the interest of time, we'll move quickly into public health implications. I think, the funding agency, they are in. So we interested about understanding this. So this is one of the project. I think the public health implication and the critical infrastructure failures has become so intertwined, and that it is very difficult. So in the resource constraint, we'd like to highlight that, the lack of electricity was a primary reason to shut down the facilities, not to be able to provide the critical care and so on. And actionable item will be think about, more diverse power generation system, keeping just a generator, backup generator, solar systems, and so on. And there might be different types of, management and coordination to make sure that every hospital has this different source of power generation, so the system can run. If one fails, the second one can kick in, and if the second one doesn't work, the third option can kick in, and that types of situation. The second implication we had is human resource management in the whole healthcare providing systems. We identified, for example, engaging nurse in a much more advanced level healthcare activities. Puerto Rico is one of the area or territory where how much the nurse can do and what extent the nurse can be involved is very different from the rest of the US. That's what we learned throughout the project. And many improvement can be done just by giving them more, engaging them in a higher capacity and so on. Also, the decentralizing the systems. Indonesia is a good example how they did after tsunami. They revamped their whole healthcare systems by decentralizing, creating different regional centers and so on. I think that Puerto Rico may have some, get some mileage looking into the Indonesian model as well. And the last implication we have is one of the major things that even the limited doctors, nurses that are in the service that are providing cares and so on, they could not do their best because of the management practice. For example, major surgery, they need insurance approval from primary care providers and all that's the bureaucracy. These bureaucracies, there should be a mechanism to be waived during an emergency to when it's a life and death situation and so on. So these are, some of the actionable items we highlighted, but there are many more in our report. We, invite all of you to read the report, and if you have any comments or questions, we'll be happy to, listen to that. But basically, I think we have some very primary findings to build some sort of a conduit between community, public health stakeholders, and emergency management, which basically can be a foundation for thinking about the resilient health system in Puerto Rico. That's pretty much all we have, and we very much, like to thank all the participants who participated in our study. They gave their valuable time. They were extremely difficult schedule, but within their schedule, they took the time to listen to our questions, our research project, and so on. We are very thankful to them. And that's pretty much, and again, Laurie and her gang really was very instrumental, so we could actually pull this out. And we really, enjoyed this whole process. Thank you so much.
Thank you, Paula, very much. And thank you for that presentation and for the information and implications you shared. Very much appreciated, and very much, again, looking forward to our final presentation in this series. And then we will turn all remaining time to Q&A. So Paula, if you would, let me say thank you for stop sharing. And then Federico, you are last, but certainly not least in our lineup here. So if you would, let's see. Okay, I can see your slides, Federico. They are not yet in full screen. Oh, now they're in presenter mode. Maybe if you could go back to the view we were in, Federico. There we go. But what I think maybe we go with this. Looks good. And then very nice. Okay, and then Federico, are you off mute?
I am.
Okay, there we go. Over to you. Thank you. I'll start the timer now.
This will move here. Well, thank you all. And there's yet another project about Puerto Rico that shows the crisis that continue in the island of enchantment, of this enchantment with crisis on and off. And appreciation to my research team. It's not my research team. We were all on this together, really working extensively beyond what we originally envisioned, but we got the project done thanks to the guidance that we had from all team members and the participation, and including the guidance from you, Laurie, and your team. So let's see if this works. If I go to the next one, is that shown? We're good.
Yes,
okay.
Good.
So in times of crisis, we wanted to know how the people are informed about crisis, and Fiona provided an opportunity to inquire about how news media people do so. And we wanted to focus on Puerto Rico, but then I just happened to be in Puerto Rico when Fiona went by, and I saw the problems, and I said, well, I'll pay attention to this call for proposals, and there it was. And as we're working on it, Ian hit Florida, and we said, well, why not include our Puerto Rican communities in Florida? And we wanted to examine communication resources used by these communities to learn, identify the lessons learned and the risk communication challenges they had experienced, to offer recommendations to improve the exchange during disasters that happen much too often in Puerto Rico. And our research timeline is shown on the screen. What the last box does not, in May, we finished our first preliminary report. What this box does not include the fantastic jornada, the forum that we had July 19th in Puerto Rico, but we'll add that to our subsequent writings about this. And these were our research questions that the news media decision makers gather. How did they do their job? to gather, evaluate, and disseminate crucial health and risk information prior to, during, following, and during the recovery efforts from the hurricanes. How did the government information officials do their job to gather, evaluate, and disseminate the information that they were responsible for, both in Puerto Rico and in Florida? And these are two different locations. We wanted to check the similarities and differences between the operations, practices, and policies of news media and government information personnel in both places. And of course, we wanted to get to recommendations for improving the processes of gathering and evaluating and disseminating information for both locations. And here we had a mixed method, qualitative and quantitative approach as well. And for us, it was bilingual because we had to deal with the Spanish speakers in Puerto Rico and in Florida. There were some Spanish speakers, but we had to develop a questionnaire that was in English for the English speakers that we dealt with in Florida. We had government officials and news media directors from both locations, and we had a 15-item questionnaire. And we also had personal interviews with open-ended questions, and we had a roundtable discussion that we have a footnote about that because of the limited number of the sample and the study roundtable, the discussions conducted with communication experts with risk communication experience during the Hurricane Maria in Puerto Rico to validate what we were doing. So this was a comprehensive as much as we could, given the number of people that we were able to get to respond. And for some reason, news media people like to ask questions, but not to respond to questions. We stated that before. We used the Qualtrics platform that our collaborator, Patricia Garcia, developed for this. And of course, we had the guidance of all of our team members and some other experts that guided us on the questionnaire. And going quickly to the preliminary findings for the media, I'm going to start with the media. Inadequate training, news personnel shortage, social media infodemic, and technical challenges. But I'm going to go on to a couple of these. The inadequate training is because there is no school in Puerto Rico that offers risk, at least not yet, that risk and health communication courses or practices. It's on your own that you learn it. Some people do have some limited training on occasion, but it's not as depth as it should be from a school of journalism or communication. The news personnel shortage, because the media in Puerto Rico, as other parts of the world, are facing challenges for keeping people, given the loss of revenues and advertising. So they just have this approach of whoever's available who will do it, and then who will do the work, but not necessarily the best people. They're not properly trained to do so, as I already mentioned. The social media interfere, as there's lack of information from general market media and even alternative media. The social media come in with their individuals' perspectives on what should be done or what's going on. And then the technical challenges are the loss of electricity, the power loss, the lack of the technology that would be working for that. In the technical challenges for the government are the loss of electricity, once again, the misinformation and disinformation that interfere with what is being said from official sources, because sometimes the official sources contradict each other. Too many decision-making officials at different levels, from the higher levels of the government to the municipalities, where the people who do the information, provide the information to the local publics, are people who are political appointees, not necessarily the best ones for doing that unless they've been trained. And too many of them are just whoever happens to be the friend and whoever happens to contribute to the political party is appointed to do that information processing, information gathering, and disseminating for their local communities. There are technical language barriers in terms of what sometimes is said versus what is understood by the public. The personnel turnover I mentioned rather quickly. It's again every administration, every municipality at the government at the higher level or lower level of government. Every time there's a new governor, every time there's a new secretary of whatever, every time there's a new mayor, it's whoever comes in brings their own people, not necessarily the best prepared for that. And then there are the problems of the inaccurate risk predictor systems, such as stating that hurricane category 1, people don't worry about it, but hurricane category 1 is just in terms of winds, not necessarily the amount of rain that will be falling and for how long that will be falling. So that becomes a major problem for how people understand and deal with this. In both government and news media, risk communication challenges include these points that we have here. They struggle with conveying technical language, unofficial information, misinformation, disinformation, and social media are a risk for both government and for media staff and decision makers. I'm gonna go over to this wonderful chart that my esteemed colleague Amirersa prepared, in which it shows the energy and internet signal challenges. It's one of the 5 major categories of problems, and she has them differentiated for Puerto Rico, for news media, and for government. Both of them are there. In Florida, there are fewer of such challenges because the electric system is a lot more stable and the internet signals are a lot more consistent. The misinformation and disinformation challenges are similar for both, and for both government and media in Puerto Rico and in Florida. The training challenges are a major issue for Puerto Rico, less so for, well, there are major challenges in Florida, but less so. There's just a bit of the differences for both of these. The organizations of how the government structures are set around to deal with these crises are different in both places. And the content challenges, as we've mentioned, because of the misinformation, the lack of appropriate personnel for dealing with this are again major. Their similarities and differences are listed in this chart, which will be available for people to see. One of the points to highlight is that in Florida, Puerto Ricans and all other Spanish speakers don't have as many resources to go to for understanding what's going on in their language. There's a lot that's going on in emergency crisis and information and news in English language media. Spanish language media don't have so much, and government officials, although there are some that speak Spanish and will get that information, there are not the quick, immediate, efficient channels through media, news media, or even government officials to inform that population. When we go through the public health implications, these are quite evident here, because the efficiency and effectiveness of disaster risk and health communication policies and practices increase the morbidity and mortality associated with chronic diseases about which people don't know what to do, what's coming on, how to overcome them. There's lack of information about flooding and destruction aftermath directly, how it directly harms public health, where the water is contaminated, how the leptospirosis and other infectious diseases gather and spread in the pools of contaminated water. There is no efficient, quick, immediate information about that, even preparation or overcoming that after a hurricane has hit. And then the vital implications for the news media and the government officials, that there is no trust. I mean, there is lack of trust in government to begin with because of the political crisis and the lack of electricity and the cost of living and many other things. So when it comes to the health information, there isn't that trust that is indispensable for people to pay attention to the government officials or to reliable news media. And then they end up going to the social media, which is packed with lies or disinformation, and how drink some Clorox and that'll clear your COVID type of situation.
And
that
Federico,
yes,
sorry, you
time's up.
just have a 1 minute remaining.
Okay, so we have the public health implications here. I've highlighted them already, and here I'm going to point again that we have a lot more work to do because there has to be some training. Fortunately, one of the things that this project brought us to is to connect with people at the Catholic University and other institutions that are eager to connect and work with us for future research and activities. Our recommendations are regarding research and to engage in education, and we have lots of people to acknowledge and appreciate for this from across the board, and thank you for guiding us from the beginning. I will stop sharing.
Thank you so much, Federico, and thank you to your team members who are here. I saw Gary earlier, and I see Gary now, and it's just great to see your team on here too, and thank you for that presentation, and a big virtual round of applause to all 4 of our presenters. And just want to remind everybody on here that the reports for informing these presentations are on the Natural Hazard Center website. We hope you will go and access them, and really the reports are really stellar from these research projects that you heard today. And so thanks to the wonderful presenters as well, really staying on time. We have 10 minutes now for question and answer and just conversation. And so Chris, the ball is over in your court for the first question. And if you have a question, please just
I have
raise a hand.
A question and then an observation and then a noticia that just came to me today from Russ Strickland. The first condiment Shandul is on the people that are vulnerable, these voices of vulnerability that you're trying to help and deal with and coming up with solutions. There's something that occurred. I'm working on with a couple of people, Alexander Crampton from Marquette and Irene Connon, who's at Stirling in Ireland, and it has to do with concept of social disability. When you have elderly, when you have isolated, and you have rural, social disability is something that happens when there is a breakdown of resources of any kind, energy, the loss of social capital. This was very common in the pandemic. So that's just something to think about. I will send you the definition of that and information on it as it develops. So that's one. The second, our last presentation, compadre, Federico, I saw a lot of similarities between the 4 corners in Navajo land and Puerto Rico on different cases having to do with flooding, the pandemic, but there are similarities. I really want to talk to you about this in detail as we start up our center there on resilience and recovery. And then lastly, the National Security Council is considering establishing a center that has to do with long-term recovery. All of these instances, often there's before, during, and after, but what happens in the diachronic sense of events? So I'll keep.
Christopher, we're losing your voice.
Comments and ideas.
Laura, you're muted.
Laura, you're muted. Your microphone.
Oh, sorry. I'm sorry. I was telling Chris that we were losing him and you're losing me. I'm so sorry, everybody.
Okay, I'm sorry.
But yes,
I'm sorry.
Chris, I think we caught the tail end, and then I was just saying if Shardul or Federico maybe want to respond. Thank you very much.
Okay.
Yeah, no, I just wanted to say thank you, Christopher. Yeah, the social disability model, it'll be really helpful to look at. It did come up in the interviews, particularly because of the demographics of the region. So I'm looking forward to the work that you share. Thank you so much.
You're welcome. I'll get that to you.
Federico, I see your hand up. I'm not sure if you wanted to respond to the question or say something else, but go ahead.
3 quick points. We really had a great conference or forum in Puerto Rico, and Gary was there to give a keynote, and Sandra and Mirasa were indispensable for organizing that. I had to mention their name. I didn't mention their name as part of the team that made this possible. Number 2, yes, Christopher, we'll get in touch to follow up on what we can do, because we are looking forward to continuing a lot of research that is missing. If there's one finding from Puerto Rico, is that neither the government nor the media evaluate what they do. An outsider has to come in to ask them, and then they don't want to respond. They're not evaluating what they're doing to then improve. One of our respondents said, "We are here to put out fires, not to prevent them." So probably similar. And a quick question for the folks in the lake area. Did you find a situation such as when there's jaws that people didn't want to tell the community that there's sharks in the water close by because they would scare away the tourists? Does that happen in your area, that they don't want to tell people that they're algae so that people don't get scared and avoid the area?
Well, so far we haven't really run across that. Interestingly, there is sort of sort of a willingness and a desire to do something about the problem, and very sort of in a on the ground sort of fashion, which is I think in part due to how long the 10 Mile Lakes Basin Partnership has been working on this problem and talking about it. I think initially in like the 90s there was resistance, but there's been a change and a sort of recognition that, or a cultural change really, that they rely so heavily on the lake for tourism, that it's really important to do something to address the underlying causes, which I mean, that is a tribute to the local organization there that's been working for years on that. I think there was actually more concern about, you know, tourists that might come in and not know, and not be on, you know, not be on the Facebook page or receive the local newsletter. I had a question for both teams working in Puerto Rico. I'm asking kind of as a US citizen, because you know, I hear that there's not enough attention from the media and the government, and I really would love to know, like, what can I do in terms of thinking about, you know, what is a, you know, like listening to both presentations, thinking about how critical public health workers or community health workers are, you know, nurses that are trained on the ground, or I'm also a veterinarian, and, you know, I think, gosh, there's definitely a role for veterinarians to communicate out in the world, and especially in those critical situations. And I know this is a big open-ended question, but just I'm really wanting to know, is there some specific focal area where, just if you're a day-to-day citizen and you would like to divert attention back to the ongoing issues and not just have it be a cycle of this disaster event happened and now we're focused there for 10 seconds and then the national conversation goes away and back to where it was before. And so if you had any thoughts for people, just other researchers wanting to help and support your efforts and bring attention to where it's needed.
Thank you, Amber. I'd like to comment on what you just said, because after Maria, we had this situation where we had a lot of help coming, but it was the disaster was so big. For example, the energy infrastructure wasn't a bad condition before the hurricane, and after the hurricane it was damaged so bad that we still today, we're still having terrible problems, even without any hurricane coming. We're having a terrible energy situation, and it's mostly because of what you said, that during the disaster, all the attention comes and all the help comes, but like Federico said, and I want to make clear that the person who said that we're here to put out fires, not to prevent them, he was not saying that that was what he wanted to do, but that was the reality of our culture. And that's part of why this this research, we focus so much on effective communication, because we need to look at this problem from a prevention standpoint more. So thank you so much for your comments.
And Paula, we just have 1 minute left. Would you like to say something in response to that question based on you and your team's work in Puerto Rico?
Sure, thank you. And yeah, we learned a lot. One thing is we learned there is a ground level differences. For example, how the nurses get involved in the healthcare, how the pre-authorization, that kind of management practice can make a really difficult, situations in the outcome. Those are like a very ground level challenges, which can be probably fixed with some political will and, management, insight and so on. But there is also something at the very high level, Puerto Rico is part of the US, not part of the, in some agency, Department of Commerce, Department of Defense, how they designate Puerto Rico in their operational ways, which actually, when these types of extreme event happens, it creates some sort of a bureaucratic quagmire in terms of during, after, before, and we can go on and on what types of challenges it brings in. So disaster actually, for the disaster research, it helps us to open our eyes and see that types of, layers in terms of responding, recovery, expediting. So we actually have very, bird's eye view versus ground level view, and we learned a lot. And actually, in the future, we'd like to highlight some of those things, and and how the rest of the US manages this risk, and how Puerto Rico is different in terms of their situations and so on. And would like to probably, highlight some of those features in the future. Thank you for the questions.
Thank you. And I am so truly sorry that we are out of our time. And I just want to acknowledge the presenters. Thank you so much, the presenters and the research team members who are here, and for the work that you shared. Thank you to the participants who just came to listen and to learn from this fantastic group. And one of the requests that Robin made of us when we transitioned into these rooms was to really try to start making connections with one another and across projects. And I really see that happening in the chat. I see it happening here. And so thank you for that. And I also just really want to end on sort of where we're at the Natural Hazards Center. We're completing an evaluation again of round 1 and round 2. And I think what has really been breathtaking to us has just been seeing the depth, the scope of the collaborations and the connections that have been created, but also sustained through these projects. And so we just really want to uplift the time, effort, and care that each of you have put into these projects, because at the end of the day, I know a lot of that doesn't end up getting placed in the formal journal article. It doesn't end up getting articulated, but it is the fabric that is really weaving the individual projects together, but also across the projects. I also just want to again say about the extraordinary level of effort above and beyond the reports that have been produced, and really want to acknowledge that and acknowledge the researchers who are here. Thank the CDC again for the support that has made this all possible. And thank you to all of you for the work that you do. It is clear it is urgent and it is needed more than ever. And so with that, we're going to stop the recording. We will have the recordings available on the website. We'll work on getting the slides up as well. And I hope that all of you take care of yourself as you take care of others, and have a great rest of the day and a great August. Thank you to everybody. Take good care.
Thank you, Laurie.
Thank you.
University of South Florida.
And so, like Jolie mentioned, the title of our work is Evacuation and Recovery Implication of Compound Hazards on the U.S. Territories. And so Elizabeth Dunn and I are splitting the presentation. We're co-presenting. So Elizabeth, please, go ahead, and I'll wrap up at the end. Let me know when you want me to advance.
All right, so you can actually advance slides. All right.
Yay. Okay.
So this study is a continuation of previous research designed to capture data that contributes to knowledge on pandemics and then risk perceptions with confluence of natural hazards in the U.S. Island territories. And so here we focus on a continuation of evacuation decision-making in a post-vaccine COVID-19 era with new subvariants and with residents continuing to have to make complex decisions. So specifically, this research was designed to add to the existing body of knowledge, comparing intended evacuation behavior, both pre and post-vaccine availability within Puerto Rico, and to kind of continue on from the research that was done there. So furthermore, it's also allowed us to look at developing a survey for Hurricane Fiona, looking at evacuation decisions and recovery at this point in the pandemic in the last few months. So, but since the pandemic, as you can see, our team has conducted numerous evacuation studies. In 2020, our team was funded by the Natural Hazards Center to examine public perceptions of residents in Puerto Rico and the Virgin Islands region on the compounding risk posed by hurricanes, landslides, storm surge, and on top of that, the effects of the pandemic as well. And so that study was pre-vaccine and really provided further insight into the extent at which people risk their lives by sheltering in place rather than evacuating. And our team really found that over 50% of the Puerto Rico Virgin Islands sample considered themselves vulnerable to COVID-19. And when asked about their intended actions for the 2020 hurricane season, a significant number of individuals who would have previously evacuated to a shelter said that they would choose not to during the pandemic. And so this really reflected that public shelter usage has the potential to decrease when the decision is coupled with COVID-19 threats. So in addition, individuals have a negative perception of public shelter options, and approximately 50% of the respondents had little faith in shelter's ability to protect them. And 3/4 of respondents found the risks of enduring a hurricane to be less than those posed by public shelters. And so these findings were based on our initial survey. And then what we did was we kind of built upon that and dove into, once vaccines were available, what that kind of looked at. So actually, can you go one slide before? Sorry.
Sure.
So during the 2020 hurricane season, like we mentioned, we had about 457 people respond from 120 zip codes. There were about 70 questions that we asked. This was mostly geared towards that pre-vaccine availability. And so with that, we wanted to kind of look and see if that changed when vaccines became readily available. So with the new survey instrument, we addressed whether vaccination status affected hurricane evacuation plans, whether the availability of vaccines affected the hurricane evacuation plans of residents compared to pre-vaccine era of COVID-19, and then whether perceptions of other people's vaccination status affected someone's evacuation plans. All right, so next slide. And so what we looked at with our second survey instrument was we kind of cut it down to about 50 questions, and we focused on administering it to residents in Puerto Rico and the U.S. Virgin Islands between the months of March and May of 2021, so early on in the availability of vaccines. And so our questions really wanted to kind of look at not only the impacts of COVID-19 on evacuation plans, but also potential evacuation decisions during the 2021 hurricane season. And then also looking at demographic information and geographic information. And so we ended up having about 547 responses with 392 that fully completed the survey. And so we actually used, when we were analyzing our data, we used SPSS and ArcGIS Pro. We did some chi-squared tests, Spearman's Row, and then also we looked at some hotspot analysis for looking a little bit deeper into our findings. So you can kind of see we tried to reach quite a few areas, especially coastal areas all throughout Puerto Rico, and then all of the U.S. island or Virgin Islands as well. All right, next slide. And with our findings, as we kind of were diving into the analysis with this grant and this research, this continuation research, we found that a lot of respondents, that quite a few were actually fully vaccinated, with at least fully vaccinated or at least with their first dose. And so we could kind of dive in and see that a lot of the population of Puerto Rico was more significant to be vaccinated than those in the Virgin Islands. Also, we looked at how more than half of our respondents considered themselves vulnerable to COVID-19 due to compounding health concerns, or that kind of made them vulnerable, or household members that made them vulnerable to the virus. And so about 66.2% of respondents said that someone in their household had a health condition that could lead to adverse effects. In addition, we saw that evacuations, when it came to evacuations, 63% of respondents ordered or advised to evacuate in the past did. And 67% suggested that if they were to be ordered by, like, with a mandatory evacuation order, they actually would evacuate. Renters were significantly more likely to evacuate than homeowners. And there were quite a few people that indicated at 43% indicated that it would be somewhat difficult to evacuate their island if they absolutely had to. And about 43% said it would be difficult for themselves or their family members to leave their homes in general as well. We also saw that there was a significance with pet ownership. They were more likely to stay, which kind of aligns with previous research that we've conducted. So what we found also in our findings, when we were doing the hotspot analysis, we can actually pinpoint different locations within the islands that you can see, spatial patterns in terms of locations where people were more likely or less likely to evacuate with the hotspot analysis. And so you can kind of see in the top left figure, respondents near San Juan, Puerto Rico, were significantly more likely to evacuate during a severe hurricane. Whereas kind of in the bottom right figure, you'll see respondents in the southeastern areas of Puerto Rico were significantly less likely to evacuate for a hurricane if ordered by emergency management. All right, and next slide. And you can take over, Leslie.
Okay. Okay, so what are the public health implications for this work and for this study? The study highlights the perception of a compound risk in people's decision to evacuate during a hurricane. Results suggest that we must provide safeguards and shelters and educate people of these safeguards. And results help us to provide local emergency management bureaus and shelter operators to better understand how to develop communication strategies to help residents with their hurricane evacuation decisions, especially people with, we say here, chronic disease or chronic health conditions, but other health conditions or family situations that might limit their ability to actually move to a shelter. So public health implication 1, overall, during the time at the time of this survey, citizens of Puerto Rico and the US VI were more concerned about the risks of COVID-19 than those of a hurricane. And this was indicated in the results that Elizabeth shared. public health implication 2, the results suggest that we must provide safeguards in shelters and educate people of these safeguards and the benefits of shelters. Otherwise, they may put themselves at risk of impending hurricanes attempting to avoid the risks of COVID-19. And I think, you know, even though COVID-19 right now is not quite as much of a concern as it was during the time of this work, this still rings true for hurricane seasons into the future. So I think if hurricane shelters can be adapted to suit the needs, specific needs of people with chronic diseases, or people with you know, elderly people in their home, or if there's also like transportation provided for people, they might be more likely to utilize the shelters. So I just included here some images of how shelters look. These are examples actually all from Puerto Rico, not from the USVI, but they're very varied in how they look and how they're operated depending on where they're located in the island. And then results help to provide local emergency management and shelter operators to better understand how to develop more effective communication strategies so that residents feel confident with an evacuation decision, especially those with chronic health decisions. And here we just have some examples of how—
Just your 1 minute mark. Thanks.
Oh, yeah, perfect. We're just sending. So we have examples here of how this information is shared with the public. Typically, like you see some social media here, and this is just from one municipality in particular. And then lists of where shelters are located. But factors such as transportation, availability of medicine, availability of services for people with existing health conditions, these all could play a very important role in people's decisions to use shelters. And so if these aspects are sort of promoted and communicated to the public, they would probably be more likely to seek safe shelter within the publicly operated shelters, including space for pets. And I think that's it. We'd just like to thank the Puerto Rico Public Health Trust, Melanie Rodriguez, Los Mariel Tirado, the Division for Disasters and Emergencies at the Public Health Trust, Amy Pollan, who was instrumental in creating survey questions, and our extensive stakeholder team for their efforts in survey question feedback, testing, and distribution, and the Natural Hazards Center for providing this opportunity to conduct this research. Thank you.
Thank you so much, Leslie and Elizabeth, and we'll be moving on now. I just want to take a moment to say, if you have any questions, please drop those in the chat. When we get to the Q&A period, we'll have you unmute yourself and ask them then, but then we'll know who to call on. So next up is the team that created the report assessing intra-community public health impacts from compounding food, energy, and water studies. So if you guys want to get started there, thanks so much.
Hi, good morning, good afternoon. Can everybody see my screen? Thumbs up. Awesome. Thank you. So my name is Anais Roque. I'm going to be presenting on behalf of my team, who is composed of Eni Quintana, Samir Shaw, Mary Angelica Painter, Fernando Cuevas, and Fernando Tormos Aponte.
Oh, you're muted.
You're muted. Can you hear me now? Yeah. Okay. Okay. Should I start? Yeah, no, start from the beginning. Okay, I'll start from the beginning. I'm sorry, guys. So did you hear my presentation, like the presentation of my co-authors? Okay, so I'll start here. Start the second slide. Great, sorry. So our project had two main objectives. The first one was to explore the relationship between social capital, meaning the relationships that occur within a community, across communities, and with communities of power, as well as community health resilience in the wake of compounding hazards, but really focusing on issues of food, water, and energy insecurity, which we understand as availability, accessibility, reliability, and quality of these services during disasters context. And from there, we also wanted to develop an accessible and action-oriented survey for community leaders and public health officials to assess local needs before, during, and after a natural hazard. We did this work in Corcovado, Puerto Rico, which is a community in the west side of Puerto Rico. It's a rural community that has been organized for more than 30 years. And we did this using a community-based participatory framework and had 2 community members as co-PIs of this project. Phase 1 of our project was between December 2021 and July 2022, and our continuation award started in January until July of this year. So specifically to this continuation award, we focus in co-developing an accessible and efficient survey for 2 main things. One, for that communities can understand, interacting, and informing impacts of food, water, and energy insecurities, but also their relationship to public health outcomes. And second, to obtain input from experts and community participants to enhance the design and usability of this survey. We did this through a series of steps. First, in our first award, we conducted 2 days of community workshops to understand community experiences with compounding hazards, food, water, energy insecurity, and health. We invited 16 community leaders, and we worked with them 2 days. The first day focusing on these 3 areas, and then the second day we co-created an activity where community leaders can express areas of interest and prompts related to food, water, and energy insecurity that they would like to see in an action-oriented survey for them to deploy in their own communities. And this idea really just overall comes from 2 things. First, because in the literature, we were seeing that there's not really assessment tools that can combine food, water, and energy, and we believe that considering the impacts of hurricanes Irma, Maria, earthquakes, and all these different hazards, right? These 3 resources are interconnected and explicitly impact health. And then the second part is that a lot of the communities in Puerto Rico and other territories do a lot of the emergency management and response through self-management, and the government not necessarily is the first responding to these processes. So we wanted to co-create a tool that could be not only easy to collect data, but also to analyze data and utilize this for action in communities. So based on those 2 workshops, we collected all that information, and then along with literature and evaluating different assessment tools across food, water, energy, and public health, we started to use both an inductive and a deductive approach to inform the development of this household survey tool. From there, we engaged in expert survey consultation. We consulted 3 food, water, or energy experts from academia on the survey that we created. And then we also consulted 4 community leaders from Corcovado that have been working closely with us during our project. And following their feedback, we reconstructed our survey, and we deployed it this past June with 13 residents of the community using a convenient sample approach called a survey of the survey, which was a house-to-household face-to-face survey, basically collecting the information from the survey, but also really asking them about, like, do you understand the questions? Does this make sense to you? Is there something that will make you uncomfortable to answer, and relate it? And we use all that information to reconstruct our survey, and that's what we're going to be presenting today. Post our award, we hope to continue now going back to our academic and community experts again to have a second round of feedback and approval on their side. And then we hope to do a full survey dissemination in Corcovado and in other communities of Puerto Rico. So as part of our preliminary findings from our exercise to co-create and pilot and test this surveys, we divided in 3 main areas. First, team question development outcomes. Second, expert feedback outcomes. And third, target population pilot outcomes. So the first area is that we originally thought we were going to do one survey that could be easily moved into 3 spaces, but we decided to really just create 3 modules: a before hazard, which is a set of questions that can be asked 1 or 2 years before a disaster declaration or after a disaster declaration, a during hazard/disaster, which can be deployed right in the immediate impact of a hazard, and up to 6 months of the in up to 3 months of the disaster impact, and then an after disaster module, which can be deployed 6 months up to a year after the impact of a disaster. And there we were able to, in that process, fix things like order, grammar, and related. When we gave the surveys to their experts, they provided us feedback in terms of clarity. So, for example, making sure that it was understandable for the intended audience, which are people that don't necessarily are academics or people that don't necessarily have high technology to be doing very complicated analysis. They gave us feedback in terms of consistency, making sure that all the questions across the 3 modules were aligned, grammar, and numbering. We had more questions in one survey versus another, so making sure that everything really was flowing and organized. And then when we deployed it with our target population, we received feedback in terms of local language. So there were words, for example, SNAP, which is the food security assistance, versus in Puerto Rico that's called PAN, and like related words like that, or motorized vehicle, and we don't use that word necessarily, so like things like that. And also gaps in questions. There were questions that were just yes or no, but maybe it didn't apply, so doesn't apply should be also an option in the survey. So with all that feedback, we were able to reconstruct our survey, and that's the survey that we're presenting today. So with that, overall, our project has 3 key public health implications. The first one is early identification of at-risk populations. The second one is monitoring health outcomes and interventions across context and time. And lastly is that our community-based participatory research framework and co-development carries important implications for understanding public health needs. It's based in our experience co-creating this process with community leaders and receiving expert academic feedback on it. So first, before I move forward, you can access, we also developed a website for the project, and you can see the 3 surveys in our website. So it's this QR code that you'll see in the bottom right corner. We also developed a video for the project to explain why this community and what was the goal of our project, and other related stuff. So you can go there and see those in detail. I'm happy to answer questions at the end. So in terms of early identification of at-risk populations, our survey, as I mentioned, collect information not only on food, water, and energy security questions, but also on mental health indicators, disability, chronic conditions, and environmental health, specifically to food and water. And this can be important to use, for example, in coordinate preparedness or response for those most vulnerable in a community. Considering a place like Puerto Rico, where there's a lot of elders, people that have chronic conditions, it's important to have tools that can help communities to organize themselves and identify who is most at risk. But at the same time, this can be used by public health officials and emergency managers to also prioritize where assistance should go first. Second, in terms of monitoring health outcomes and interventions across context and time, with our 3 modules in our surveys, we believe that we can use these to do long-term monitoring, which can be very valuable in terms of if a community already establishes an intervention for food security, for example, like a community huerto, like a food area, like a community garden, right? And so again, like interventions that are done in the community with the before, during, and after disasters, surveys, community members or public health practitioners can evaluate these across time. And then lastly, and this is like a screenshot of like how the website looks like in terms of the area where the toolkit is at. We strongly see the value through this project of what community-based and co-development carries for public health needs. So for example, with our experts, academic experts and our community experts that were reviewing our survey, we could see that our academic experts were really interested in informing theory or informing longitudinal analysis, which is very important, but not necessarily leads to the types of actions or information that our community needs to collect to take decisions about preparedness, response, and so forth. So by working with community leaders and in co-creating this type of tools, we were able to make them culturally relevant, make sure that our grammar and wording use and related were really aligned to their needs and the ways that they would like to move projects forward. So with that, like any project, it always takes a village. So I just wanted to take some time to extend our gratitude to the Corcovado community and the community leaders who participated in the workshop, also to the academic experts who provided feedback on the surveys. We thank Kenneth De Leon Colon, Genesis Alvelo Colon, Wendy Prudencio for their support in co-organizing and co-facilitating the phase 1 workshops that I mentioned. And we also thank Laura Bayona Roman for transcribing data from workshop 1, Riley Barnes for our project website and toolkit, Rio Nieves for translation of services, and Javier Nieves Torres for the interviews to validate the survey of the before hazards. And with that, I'm happy to answer any questions or concerns. And if I have time, I'm happy to also show you the website and walk you through the survey, but I don't know how much time I have left, so I'll let that to Yoli.
You have 3 minutes left. If you want to walk through that, I'll give you the 1 minute warning and then you'll know how much time you have after that.
Sweet, thank you. So I'll do this real quick. So this is, there you go. Can you see my screen?
We can.
Awesome. Okay, so this is our website. I'll put the link in the chat if it hasn't been put already. The website is in English and Spanish. You can find information of who is our team, what were our goals, which is what I described in our presentation. Learn more about the community. This is where you will find, for example, I hope the screen change as well. You will have a community overview of where is Corcovado located and why we collaborated with Corcovado, and then you also can access directly the toolkit, which is currently on Canvas as we're still open to doing some more feedback, but you're able to open it. So if you press on anywhere on the image, it will open up the toolkit, and I'm letting it load. There you go. And you can see everything from our process, the considerations we took for survey deployment. So also it's not just a survey for community leaders, it's also a toolkit to train them how to do these type of surveys, and also using accessible and free platforms like Google Forms to analyze the data. We have our analysis page, background, how we did it, all the things that I've just described, and then I'm just gonna go quickly to the survey. So for example, our surveys.
1 minute now, Anais.
Okay. Yep. And with that, if you have more questions or concerns, I'm happy to answer them in the Q&A. Thank you.
Awesome. Thank you so much for that, Anais. And we are going to go ahead and move to the next group that is presenting. And that is going to be the team that put together Mapping Puerto Rican Student Vulnerability and Risk to Improve School Emergency Planning. And with that, we'll get started. Thank you very much. And we can see the slides.
Yeah. Hi, I'm Eileen Segarra. I'm here on behalf of my team. We also include Yolanda Cordero Nieves and Amilcar Velez Flores. So we work on mapping Puerto Rican student vulnerability and risk to improve the school emergency planning. And our initial research, and I'm going to apologize, I don't have, my voice is not, I'm kind of sick, so my voice is not very good, so I'm going to try to be as clear as possible. Our initial research focused on how the school interruption due to either hazard event or emergency affected educational outcomes. But one of the things that we learned when we were doing that research is that a school didn't have effective emergency planning. So what we're doing in this pilot study is to try to create a tool that may help in that planning process. So the idea is to use information regarding where the student live in a particular school and associate that with information on different hazard risk in the area and also information on vulnerability, socioeconomic vulnerabilities from the Puerto Rico Community Survey to create a visual tool that can help the school identify what kind of risks are more important for that community and which vulnerabilities are more prevalent among the student population. In our pilot studies, we ended up using 4 schools. 3 of them were rural schools and 1 of them was an urban school. So the idea was, the first part, we have a small qualitative component, which basically included an interview with the school principal, and also we asked them to fill a short questionnaire regarding what type of resources they have, either human resources or infrastructure resources at the school to attend any emergency. Then the second part was the data analysis, and we start with basically three separate processes that were going to be merged. The first one was the geolocation of student address. So we took each student address and associated a longitude and latitude to each student address so we can map them. We also identify some of the risk layers related to hazards that were available for Puerto Rico. And the third analysis was a hotspot analysis using data from the Puerto Rico Community Survey, data at the block group level, so we can map hotspots for different types of vulnerabilities that are associated with different disaster or emergency. And the idea is once we have those 3 layers of information, we can put them together in a dashboard, which I'm going to show it in a little while. And also we all made some summary table to highlight some of the different information that we got from the data. The last part, which is still pending, which we're going to be doing now, probably between August and September, is go back and meeting with the school principals, show them what we have, and get their feedback on how to present it, how useful it is, or how can it be presented in a more useful way. And once we get the feedback from the school principals, then we want to meet with the Puerto Rico Department of Education staff. Okay. So we have 3 main research questions. The first research question was whether the student addresses at the Department of Education Student Information System were accurate enough to be geolocated. And what we find was kind of a mixed result, because many of the addresses were not completed. It's like some of them will have a sector or what we call a barrio, but they will not have like a specific number, or may have the street, but not the specific house number. Or in the case of rural areas, most of the addresses are given in kilometers, and it will have the road, but not the kilometer. So first of all, we decided that we were not going to be able to use an automatic process to geolocate. Our first try was to get the addresses, kind of clean them a little bit, and go through geographical software and see if we can geolocate them in bulk, but that didn't work because most of the addresses were incomplete. So what we did is we start going address by address using Google Maps and approximate the address using the street or using the sector. So in that sense, I think we were able to get a good approximation of where the student lived, but one of the limitations that we recognized right away, that if we wanted to extend this, the idea was to be able to extend it to an island-wide application so we can get all the schools' addresses automatic geolocate and prepare a dashboard for every school. And with the quality of the address data right now, we're not going to be able to do that. So you can use them to approximate the location, but it is, we could say, a really hands-on work that will not allow widespread utilization right away. So the second research question is how feasible was to determine the probability of flooding, landslide, and socioeconomic vulnerabilities for students in a particular school. And we were able to actually map the student addresses against the different layers of risk that we find. Most of the risk layers that we found, most of the map that we were able to obtain have to do with flooding, have to do with landslide, and also the probability of drought. We also have a map that look at crime rates that can also be associated with the student addresses. And we use 8 different layers that correspond to hotspot analysis maps regarding vulnerability that include poverty, extreme poverty, female-headed households, children living with grandparents, low education, low employment, and also the lack of a motor vehicle or lack of access to internet. We also were able to summarize some of that information in tables, in a table format, so we can present them also to the school principals and see what kind of information and how it will be easier for them to use. So, and we did find that there were important difference. For example, we have 3 rural schools which mainly have high landslide risk, but they were not really prone to flooding. But the urban school is really close to an area with high flooding risk. So we can see that different schools are gonna have across the island are gonna have different risk assessment. And also we see that there are important differences in set of socioeconomic vulnerabilities. For example, in one of the schools, we have really high rate of low education. I mean, people with less than high school degree in the areas where the student live. Another school, we have a high percentage of children living with grandparents in the areas where the student live. In the urban school, for example, we have a high poverty area, and they also have we see in that area a lack of access to vehicle, and that's probably because in the metropolitan area, in the urban area, there's going to be some public transport, while in the rural areas there are no public transport, so households are more likely to have some kind of access to vehicle. But for example, one thing that was kind of surprising, that in the urban school, we find a high rate of students living in areas with little access to computer or internet compared to the rural schools. So basically what we were trying to see with the exercise, whether it's useful now to be able to recognize, okay, for this population that goes to this school, what are the vulnerabilities in the area where they reside. I'm gonna go really quick to show you one of the, basically what we did, we did a 5 dashboard. One have all the schools in Puerto Rico, and then we did a particular dashboard for each of the schools that participated in the pilot. I'm gonna go really quick to one of them. So for example, here you have the dashboard for the urban school. All these little dots are the represent the students and where they live. This is the school. And these are the different layers that are available in the map. So you can go and, for example, if you want to map, in the case of this school, for example, the flooding risk is higher. So we can map the areas, flow areas against the map where the student live, or is also, we can look at some of the layers for hotspot of vulnerabilities. This is population living under poverty. And in this case in particular, if we want to do a close-up, so we see this is the layer for extreme poverty. That means all those blue groups where you have a high number of people who live with less than half the income corresponding to the poverty threshold. So the idea is that we have all the different layers, and then you can go to the map and start playing with the layers and see which risks are more relevant to the area, or whether students tend to live in a hotspot for any of the vulnerability that we have listed. So now I'm going to go back to the presentation. So instead of on the public health implication, what basically what we want is to develop a tool that will help the school be able to develop some actions and disseminate knowledge that meet the specific community needs, that can allow them to have a tailored a school community emergency plan. But one thing we find out, for all this to work, we need to improve administrative data. So in terms of the per public school implication, what we think is that if we understand what the risks are for a specific community and what type of vulnerabilities the community is facing, then the school can develop more target education and dissemination of information. So for example, if you live in a rural school that you have a high probability of landslide during a rain event or during a storm, then you can teach that community, for example, ways to manage water or to store water, way to store food more efficiently. So you actually can help the community learn how to deal better with a specific risk that they're prompt to. Also, the same thing with vulnerability. It's not the same thing when you have children. For example, one of the things that we find out in previous research is that for students who live with grandparents, especially kids in high school, for example, they actually start having a caretaker role instead of being taken care of. So that's the sort of thing that we have to understand when we try to attend to their need. What kind of knowledge do they need to have? So maybe they have grandparents that they need to attend to, and then you can actually provide some information that will help them do that. If you're in an area prone to flooding, then you can emphasize all the information regarding evacuation and so forth. If you are in the southern part of the island where you have the earthquake, you're more likely to felt an earthquake, then you can have some specific information on specific workshops and information dissemination within the school community regarding that. The second implication is that I think is really important, and it's something that is not
Eileen, I'm
Okay.
so sorry. I just wanted to let you know that your slides aren't in presenter mode, if that matters to you.
Okay. Now. Okay.
Perfect. Thank you.
Okay. Thank you. So in terms of the school emergency plan, one of the things we're really clear is that this tool is supposed to be used as a baseline. And the idea is to now go back to the schools and try to present it and motivate them to start a process of planning. But I think that for the planning to be effective, they have to be some kind of participatory process. So the idea is that this can be some basic information that can help the community start in a participatory emergency planning process, which is what we would like to see in each community, because what we're doing here is we're using information we get from data, but now we need to add information from the community in order for them to be able to really have an plan. We know there's different kind of emergency, and one thing that we found out when we were talking to school principals is they say, oh yeah, we have a plan. We have an emergency plan. But they also tell you it wasn't effective in the previous emergencies. And I think one of the reasons is because it's not tailored, and it doesn't include community engagement, which I think is one of the aspects that need to be included moving forward. And the last public health implication had to do with the fact that we know there's a lot of information, there's a lot of data, there's a lot of new techniques, there's a lot of mapping that are available to be used in emergency planning, but they require also to have good administrative data. So I think one implication for us is that we need to start looking at the administrative data that is needed in order to fit the different kind of tools that are going to be able to help us respond better to emergency. In our case, it was the address data. If we start collecting—
1 minute mark, Eileen, thank you.
I'm almost done. If we start collecting better student address data, then we could actually implement an automatic process when you can map those student addresses every year. You can update it and have this dashboard updated continuously. But in other instances, there may be other type of administrative data, and that's one thing that we have to look at. So that's it. So we like to thank the Natural Hazard Center for the sponsorship, and we also like to thank the Department of Education of Puerto Rico, because they're the ones that have been actually sharing data with us that have allowed us to move forward in this project. Thank you.
Excellent. Thank you, everybody, for those wonderful presentations. So we're going to go into our question and answer period right now. And we have 19 minutes to do that. And there's not a lot of us. So I think maybe the best thing to do would just be like, let people come off mute and ask questions. Maybe to start us off, maybe Elizabeth, could you address your question that you had put in the chat earlier for Anais and her team? If you don't mind, I don't mind. I'm sorry to put you on the spot.
The question that I had, wait, can you repeat that? Sorry.
I think you are asking them about questions perhaps that they might have wanted to have in that space.
Yeah, I was kind of looking at your survey, and I didn't know if there was things that, like, as you were looking at your findings, if there was anything else that you wish, like, you could also learn more about, like, that we can continue on with, like, future research that might be beneficial.
Thank you for that question. Yeah, I was thinking about that. I think that something that we've discussed as a team is like thinking about like the intra-community, like intra-household dynamics, right? Because the survey still is one respondent for the whole household. But if you have more modules for like children or older adults, right? Like their experiences with food, water, or energy insecurity and health-related health implications may vary. So that's something that we have discussed, but we, given the limited time, we're able to dig more into that. But I don't know if Mary or Samir or Fernando have other areas that they got in their own that they would like to share with you.
Yeah, so with our survey, I think some of the issue comes around like length and like when to use it. And so in terms of like the inter-household as well, since we're looking at things like food, water, and energy security, it might be fruitful to have more questions around, who like kind of roles in that inter-household that they play, especially in terms of like gender dynamics as well. And so if they're highly dependent on like one person to like care for food and water, like how do those dynamics play out? But a lot of those questions are like really, might be seen as highly sensitive. But one of the things we actually found in our survey is, because we did community experts versus academic experts and actually asked people on the ground, is that academics experts were far more concerned about sensitivity, whereas like community experts were like, they didn't have those same concerns. And maybe that's like the difference between academic theoretical pursuits of surveys versus like community-based surveys. It's coming from someone you know, it's coming from community like mitigation planning, and it's not something that like the relationship is different. And so maybe if there's a way to find household roles and how those all play out within the survey and extend that would be a very interesting component that we could include.
Thank you.
Awesome. Well, kind of flipping that, Elizabeth and Leslie, Robin, who isn't here earlier, and I know, Leslie, that you put an answer to this in the chat, but maybe we can go ahead and like just share that with, get deeper into that with the group. A question about whether our homes had generators or not was an important factor in the decision to evacuate to a shelter. And I'm sorry, I'm reading your answer, not the question. How family size, power dependency, neighborhood characteristics, or income relate to evacuation behaviors. And so there's a spoiler alert there. If you want to expand on that.
Yeah, sure. We are looking at a lot of those factors, and we didn't really report on those results here today, but we do have data on that. And like, you know, definitely whether a family has a generator or not influences their decision to evacuate to a shelter. And then I think Elizabeth put an even more complete answer here, that, you know, looking also at like family size, number of people in the family who may have an illness or who are elderly, impacts people's decision to evacuate or not. And definitely during the pre-vaccine era, you know, I think people were almost not willing to evacuate to a shelter for their other family members that they may impact or be impacted by being exposed to COVID more than even, like, you know, themselves. So Elizabeth, I don't know if you want to add anything, but your answer is very complete here.
Yeah, I think this really helped us because we asked so many questions with each of our first surveys. It allowed us to understand what were we kind of missing, especially when an actual hurricane hit. So unfortunately, you know, we saw the devastating effects of Hurricane Fiona last hurricane season. So that's allowed us to see where we want to fine tune our questions a little bit more. But it was really difficult because you're like, okay, we want to stay very clear and concise on what our research questions are, really focus on our research questions. But having these conversations allows us to see what can we dive in a little bit more and look at the data, because we have the data here. But it allows us, like, by asking that question, like, what do you wish you would have known? Because we can dive into stuff that we found, that we asked, that maybe we need to report on, especially for practitioners to know, you know, what we're seeing across some of the islands. So I think that's great questions, because I can jot that down and say, hey, what can we look at? What can we expand upon with our research? Because we do want to continue to publish and give more details and information that we're finding. But what do you guys want to hear, kind of thing? So I think it allows us to kind of see, okay, what can we dive in a little bit more, and what questions should we be presenting in our publications as we kind of continue and move forward, but also what questions are we missing, or should we dive in a little bit more deeper when it comes to evacuation behavior and the pandemic and these compounding, you know, threats. So great questions, honestly.
Actually, I wanted to ask you something, because when I look at the hotspot map and I see that people in the southwest part of the island were the less likely to evacuate, and it seems to me that it probably had to do with also the exposure to earthquake, because after the earthquake, they were really worried about being indoors. So I think that compounding hazard effect is also somewhere in there.
Yeah, I think this was something me and Leslie we talked about in the team, you know, as we were kind of going through it, saying, oh man, there's so many other factors that could influence some of the behavior, especially with the earthquakes that happened a couple of years ago. So this was definitely something that we talked about, and and how can we actually think about that a little bit more in terms of the questions that we're asking as we kind of go forward with the research.
Yeah, we not as part of this study or this body of work, but we apart separately, we did do some investigations of informal shelters that popped up after during the earthquakes, during that whole series of earthquakes that happened. And it was interesting because these informal shelters did pop out in outside areas in parks, and then were then later supported by municipalities in terms of delivering water to the area, or bathrooms and hand washing stations and things like that. And that was sort of right before COVID. So you're right, Eileen, that maybe could have had something to do with it. It's interesting.
Does anybody else have any questions they'd like to interject? Go ahead, Mary.
Yeah, hi, Eileen. Nice to see
Hi.
you. I have a question for you about your data processes, because I've worked with a lot of very large data sets on Puerto Rican addresses, and years struggling to find ways to geocode those addresses. And I was wondering if you could maybe speak a little bit more about the size of your data set and maybe what you're thinking about in terms of bettering that process. Is it that addresses are more systematic and people write it down better at the front? Is it a matter of having more people being able to help hand code? Is it a necessity to have better geocoding processes for you in Puerto Rico addresses specifically? Because they're very, very different than the United States, and using, coding language for geocoding across sometimes doesn't work very well. So I just wondered if you could expand more on that.
Well, our problem was that the data really wasn't complete in many cases. First of all, we have to clean it. And we didn't have that many data. And that's one of the reasons why we decided to stop recruiting school when we have 4, because then we realized that we were gonna have to do each address one by one. So we have in each school, there were between 100, one of them 200 and something. So we probably have about 500 to 600 addresses and we're geocoding. So it was doable, but it won't be doable for the whole school system. So there is a problem with Puerto Rico addresses. And I think that right now the census is trying to work on that. But I don't think it is really the issue when we're looking at the data we were using, because, for example, in the rural area, what we need is the road and the kilometer. If we have the road, kilometer, and municipality, it can be geocoded right away. So our main issue was, for example, they give you the road and the municipality, but it did not include the kilometer. Or in urban areas, they give you the street and the area, but they will not give you, for example, the house number. And I think it just have to do with a sloppy process. For example, if you look at the data that we got from the Department of Education, some of the addresses were all in one column. Some of the addresses were divided into columns. They didn't have a specific format. They didn't follow a specific order. So I think the easiest way to do is to implement automatic data gathering. For example, when we file the income tax, there is very specific items that you have to fill. They ask you for the street, they ask you for the number. So you have to be filing each of them one by one. So if you actually use an adequate data collection tool, we may have a good set of data that we may not be able to geocode all student data, but we may have more complete information. So I think it's just that there haven't been really careful about how they collect the data. Is data that basically they use when they're checking if the student is going to go to that school, but it's not really, they're not using that data for anything else, so they're really not being careful about it. And it happened, for example, in some of the research we did post Maria, one of the problems that the school have is that they didn't know where the students were. And the social worker and the principal, they usually have to go to the community and be looking for where the student live, because they don't have good residential data. And I think it is a matter of convince them how important it is for them to have it. Because I think I think there should be an easy way to fix it, at least to have, maybe you won't be able to have perfect addresses, maybe you won't be able to automatic geocode on 90% of the address, but maybe you'll be able to do 75 if they're actually recorded correctly. So I think a better data entry system will help on that. And all the enrollment is done now electronically, so it shouldn't be that hard.
Yeah, I do work with Department of Health data from Puerto Rico, and it's very, very similar issues across departments. But like our work is much more at the census tract level, not necessarily address level. So we have a little more buffer room, but yes, I just agree and hear your struggles, and yes, understand.
Well, it seems as if we've kind of lost some people here too, and so I would encourage anybody to just speak up if they have questions. But if not, I have a question, and some of you guys have already touched on it, so I'll just wait and see if anybody else wanted to explore further any other aspects of each other's research.
Actually, I think, for example, I think that the work that Anais group is doing can actually be merged. For example, if I can convince the schools, or we can convince the school to start a participatory project, I think some of the tools that they have developed can be used for the school to actually, maybe that disaster survey be used to assess what type of need the school community has. So I think this type of workshops are really good in that sense, because that gives us idea how to integrate the information we get.
Well, I love hearing that, because that's definitely kind of almost like, that's definitely the point of these programs and funding this work is so we can extend it. And actually that ties into the question I was going to ask, because one of our goals with this program is to plant the seeds for future research and partnerships and applications. I wanted to encourage you, and I know you've done this somewhat, but if each one of the teams just wants to take maybe a minute to expand on what you have planned beyond all this work that you've just done, if you've even had a chance to think about that, because I know you've just gotten it done and it's been a lot of work. So please speak up if you would like to. Thank you.
Well, I think for us is the idea of actually engaging the school community in some participatory emergency planning process. I think if we can get some of the school to start those processes and maybe serve as a pilot, and then be able to promote it in other schools also.
Eileen, I wanted just to reach out and let you know that we through another grant program, actually through CDC, it's called BRACE, Building Resilience Against Climate Effects, Health Impacts from Climate Effects. We're working on and thinking about contemplating working with schools also, creating train-the-trainer models for teachers and curriculums on health impacts from climate effects. So possibly we could work together into the future as you're thinking about your tools and planning and training schools to be prepared for their community area and their students where they live area, building that into sort of a curriculum that we might implement. I don't know how wide at first, because it's a small 2-year project, but possibly we could work together on that. I think it would be really great to talk, later together to think about that.
Yeah, definitely great. Yeah, because
Like
one of
training teachers to teach about this,
Mhm.
but actually you're taking it even a step further, where you're having the schools plan for their own community and the people that, those families that are in their schools. So sort of a hybrid maybe.
Yeah, no, definitely. And one of the things I've been looking at it when I look at the different presentation, and also when I was at the workshop 2 weeks ago, is trying to see what tools are there that the schools can access. So I think that'd be great if you're doing some workshop that maybe the school can access and help them in the process. That'll be great.
Well, folks, one of the things that we are always charged with at the Natural Hazard Center is starting and ending on time. And so now it's 12:30. So I think that they'll probably be ending the main webinar soon. But for now, we can just leave the room. We can leave the meeting. And we thank you so much for these wonderful presentations and for sharing your work with us and for all the massive amount of work that's gone here. Thank you, guys, and everybody have a great day.
My name is Megan Morty. I'm a research associate at the Natural Hazard Center. Thank you so much for joining us today. We are in Breakout Room 4, which is the room for expanding community engagement and research application in the U.S. territories. The presenters today are part of the Continuation Award Program, which, as Lori mentioned, is the very first time we've done this program. And it's very exciting because we have this track 2, which this room is all about community engagement, and all of the teams in this group have been working very closely with community partners to apply their research to developing a public health tool. And so you're going to hear more about that today. I am going to drop really quickly. They've all developed short descriptions that we called them community engagement briefs to describe their projects. I'm going to put that link in the chat. And then we're going to get started with our first presenter, who is Kula Francis, and she's going to describe the support for frontline government workers coping with burnout. Kula, do you want to go ahead and get ready? I think you're presenting for your team. Did I get that right?
No, it's actually me, Anna Clark.
Oh, Anna's going to present. Okay, I'm sorry.
Okay.
Go ahead, Anna. Do you have do you want to come on your video and go ahead and share your screen?
Yeah.
There you are. Wonderful. Okay, I'm going to find the link real fast to the briefs so I can share those with you. Okay, we see your screen. It's not quite in presenter mode yet.
I'm trying to get there. It's
yes.
Moving slow.
I know that there's always something going on, right? We'll give you a second to get that going. Oh. I think your screen came off.
Yeah.
Okay. So just to say, I didn't say earlier, everyone has about, we have 17-minute presentations, and then we're all going to present back to back, and at the end we'll have about, it looks like we're a little bit behind, so we'll have about 10 minutes for discussion, 10 to 15 minutes, hopefully.
Okay.
You ready to go?
Okay, can you see it now?
No, it's not sharing. Let's see if we can. It was up before.
Okay, let me try this one more time.
Okay, we see it. It's coming. There There you
Okay.
go. Looks good. Ready to go.
Apologies. So I'm Anna Clark, and my team consisted of Dr. Kula Francis, Dr. Kenny Hendrickson, and myself. So our continuation award was used to host webinars for managers of government agencies and organizations, and also frontline workers. So we had a 2-day webinar for support for frontline government workers coping with burnout. So as I stated before, this one. The purpose was, of course, to address our frontline workers within government agencies and organizations. So we focused on 9 agencies, and that included emergency agencies, service departments, and different organizations and agencies within the territory, specifically those who were impacted by Hurricanes Irma and Maria, as well as during the pandemic. The research site, of course, was the Virgin Islands, and the timeline was January to April of 2021. So our original research, we discovered there was high levels of burnout within the public agencies in the territory. And of course, because these agencies are primarily first responders, they're the ones who actually are responsible for navigating any emergencies that we have from beginning to end. The research specifically uncovered that, of course, emotional exhaustion and compassion fatigue were at the core of psychological challenges faced by our frontline government workers. So the continuation award was used to offer support to the frontline workers of the initial research. And there was, of course, increased efforts by agencies and organizations to provide knowledge related to burnout of their employees. So our 2-day webinar looked like this. We offered sessions. The first day was for managers of these agencies, agency heads like commissioners, assistant commissioners, executive directors, what have you. And their topics range from burnout prevention and recovery strategies, understanding the importance of self-care for their workers and management of the burnout of their workers. So the focus for this particular workshop was to help managers improve help managers provide information and also techniques for their frontline workers so that they can improve their self-management skills and help them increase their effectiveness so that they can be more effective workers. The second topic was supporting frontline government workers when employees hurt, interventions from the workplace. That just looks like offering empathy and compassion, basically. Recognizing signs and symptoms of burnout. Of course, you want to know what your employees are suffering from, and so that you can know whether these are signs of burnout, yes or no. And a few things to look for may be like headaches, fatigue, frequent illnesses, changes, in their day-to-day functioning. The second day webinar, the topics were creating a more resilient you, and this was for frontline employees. So in looking at creating a more resilient you, we're looking at the presenter, offered information that looked like joining a group, taking care of their bodies, practicing mindfulness techniques, helping others, moving towards their goals. The second topic was coping practices, mental and emotional health. So this encouraged frontline employees to get some exercise, get enough rest, practice mindfulness strategies, etc., seeking support, and creating a healthy work-life balance, which was focusing basically on taking time off of work, planning properly, enjoying a healthy lifestyle, having a policy at home where they don't do any work past the time that they arrive home, better time management, etc. Okay, these are our community partners. we had the National Association of Social Workers, the Virgin Islands chapter, which was our primary partner. And their role was just to offer guidance and support to our team. They assisted us with the execution of the webinar series. They offered support to participants, and they coordinated care and counseling. The stakeholders, the frontline government agencies, were our Virgin Islands Police Department, our Fire Department, Department of Human Services, Department of Planning and Natural Resources, Virgin Islands Bureau of Motor Vehicles, Virgin Islands Department of Licensing and Consumer Affairs, VITEMA, Virgin Islands Territorial Management Agency, both hospitals, Snyder Regional Medical Center and St. Thomas, and the Governor Juan F. Louis Hospital and St. Croix. And both islands, they were our only hospitals. So for the managers workshop, the managers and the agency heads who attended the first day, they left with a greater awareness, I would say, about the methods that's necessary to create a positive work environment. They were better able to engage and create policies to support their employees. And for the frontline workers, we found that the participants who attended were better prepared to cope with the workplace stresses that they encountered. And they had better resilience strategies. They're able to control the emotional exhaustion and have a better self-management skills. We recorded the series via Zoom, and we shared it with the agencies that participated and even to agencies who did not participate. And we found that in doing so, we are offering an enduring impact for frontline government workers, and we're hoping that agencies would create their own series that they will do annually. So lessons learned and reflections. So we thought that we had an opportunity to translate, we appreciated, that we had an opportunity to translate our research into practice. We found that to be worthwhile, and really exceeded our expectations. We found a great significance through our original research, and that there was a stronger sense of consciousness felt by our research team during the process of translating our research into practice. The participants commented in our chat feature through Zoom. They gave a lot of comments as far as what they encountered. They were very frank with their comments, and we respected their efforts. The series was a benefit to the agencies, the frontline managers, and the staff who attended. Lessons learned, we planned for a smaller group of attendees, and it far exceeded our expectation. Matter of fact, the same day of the webinar series, both days, we still had participants trying to join. They were trying to register to join. So we are gonna, of course, in the future plan for a bigger audience. If we do something like this, we would like it to be an annual series, because the frontline workers and the managers both expressed a need and wanted to see it continue. Things that didn't go so well, that went well. The webinar, we couldn't stop receiving praises for our efforts. The presenters were awesome. We had great presenters both within the territory on island, and we had some from the States. The dissemination of information was great. Unexpected challenges. We had more attendees than what we expected. If we had to give any advice to anyone about translating their research into practice, I guess we would say just do it, because we thoroughly enjoyed it, and it actually made us feel like we contributed to the community, and that we offered something that was a great need. We met a great need within our community that we knew existed, but we didn't know to what extent. Since our webinar, one of our presenters, Dr. Allen, was offered an opportunity to present on burnout at the Snyder Regional Medical Center in St. Thomas. So that was a great outcome. I think one of the participants was from the hospital and actually enjoyed her presentation. So they made that offer to her. While the commissioner of DHS was presenting in the Virgin Islands legislature during one of the sessions, she commented on our webinar series. She had her department attend. So that was a few positive things that came out of it that we really appreciated. And so, yeah, that would be the end of the presentation. Any questions?
Great, thank you so much, Anna. We're going to go ahead and save the questions for the end, but I've already noted quite a few that I want to ask you. That's just a wonderful project. And I put in the chat, if you want to read more about Anna and Kula and Kenny's project, you can read the brief, and they also have links there. We have the videos uploaded, so you can also watch the full webinars. Okay, next we're going to have Todd Miner. He's going to present on strengthening community disaster resilience through sustainable community first aid training. Okay, Todd, you're already ready to go. Good, that's wonderful.
Here. Okay, I've unmuted myself. Can you see my screen?
Yes, I can see it. It's not in full screen mode yet.
All right. Hopefully this will, how's that?
It's in presenter view. If you can switch it to the other one, that's fine. Otherwise, if you want to just leave it like that, you can see it good.
I'm sorry, switch it to what?
To the presentation view. It's in the presenter view right now.
All right,
so,
hang on
so
a
we
second.
can see like your notes. Oh.
No, you want, sorry, I just did that again. So
the slideshow view, the one right after presenter view.
Thank you.
Yeah.
All right. Okay, so thank you very much, Megan. I appreciate that. Our work was on taking our initial teaching of disaster response advanced first aid in the Northern Marianas and modifying that to become yet more practical, so more sustainable. That was our goal in moving forward with this continuation grants. And I want to share our appreciation for the opportunity for the continuation grants, because it really allowed us to take the initial work, which was awesome, but almost experimental, and make it just a lot more practical, and I think sustainable and going to be more meaningful. So the Northern Marianas are at particular risk for typhoons and flooding. They were the site of the second strongest typhoon ever to hit the US or the territories. And then the Commonwealth of the Northern Marianas also have extreme isolation and socioeconomic issues to deal with, which increase the risks and the outcomes of disasters. We know that due to inherent delays in emergency response, that community layperson response is going to be critical, that trying to rely on organized rescue is going to take time, and in the meantime, people have medical needs, emergency needs, and so the initial training we did back in 2021 to teach disaster response advanced first aid in the Northern Marianas is what we did, and what we realized is that it's a 3-day training, and while that was available and made sense for first responders, for firefighters, police, for the general laypersons, 3 days is a lot to ask for them to set aside from their busy lives. In addition, sending experts from stateside to teach the class is expensive and time consuming. And so we used this opportunity for the second grant to take a look at the draft of class and reviewed it. So we our initial stage was to recruit local experts. We recruited a half dozen and asked them to use a process called curriculum mapping to identify the critical aspects of disasters from a CNMI perspective and to shorten that. And we didn't really specify the time. We were hoping to get it down to 1 day or less to make it practical for virtually anyone on the islands to be able to take the class. We went through that process. We developed a 1-day course, a 6-hour course that we named Basic Disaster First Aid. And then we held a Train the Trainer class, and we prepared 8 local first responders and disaster experts to teach the basic disaster first aid. And then the third step was to coach those new instructors on how to in delivering the class and practicing that, and in doing so educating dozens and dozens of local laypersons to the concepts and the skills of basic disaster first aid. Those were our activities. We had incredible partnerships, and this is I think that's one of my big takeaways personally anyway, is just the value and the importance of community partners. So we worked with the CNMI Emergency Medical Services. We worked with the CNMI Homeland Security and Emergency Management Services, and most critically, with the Northern Marianas College and their Office of Cooperative Research Extension and Education Services. They were really our main partner and the key partner in getting the word out. They've got great contacts in the community. They use their great skills and talents, develop videos and emails to get the word out to the public. And we couldn't have done it without any of those partnerships. They really made a huge difference. In terms of outputs, as we mentioned, we developed a new curriculum, a much more focused curriculum, a more practical one because it can be delivered in a day or less. We trained almost a dozen new instructors to be able to deliver the class, and we ended up delivering 2 initial versions of the basic disaster first aid course to almost 50 local laypersons. Part of the excitement for me is that, again, this is, I think, becoming much more sustainable. So there is a basic disaster first aid class currently being scheduled for Tinian. It was delayed because of the typhoon season. No surprise there. And there's also some initial conversations with youth programs. And then just in the last couple of weeks, the University Center for Excellence in Developmental Disabilities on Saipan reached out to our team and is asking for help as they develop a disaster response curriculum for individuals with developmental disabilities. And to me, that's really exciting because we know that the special needs populations are at particular risk from disasters. And so this curriculum is going to assist in expanding the trainings. We also were excited that we recruited more women and laypersons, not just paid first responders. And we're going to be addressing some particularly vulnerable communities in the CNMI, such as Goat Island. So that part is a big positive in terms of project outputs. In terms of work products, we developed a curriculum, PowerPoint modules to teach the basic disaster first aid course. Was developed, tested, and shared with our new local instructors. It is theirs to use and is going to be started to be put into use. We also left a considerable cache of supplies, gear and some financial support to teach the classes. We've got some, what's the term I'm looking for? Funds set aside for our new instructors to value their time in teaching the class and to encourage them to teach the class. And then again, lots of the supplies needed to teach these classes, the first aid supplies. So that part we're excited about. And thanks to Northern Marianas College, a number of marketing tools, particularly videos that have been developed to market the new class. And I'm going to try to show this video because I think it's awesome. I'm not sure my technology is going to allow me, so hang on a sec here. What am I going to do? Just bear with me one sec. I'm going to try to share a different screen here. All right, there's that. Share screen, come on. All right, now hopefully people can see this. I don't know if you can hear it. I'm going to start it over again.
Yeah, we
Whoops.
couldn't hear it though.
All right, let me try one more time. And if I'm running out of time, please, Megan,
No,
let me
but
know.
you've got a few more minutes, so go ahead.
Okay, because this is, it's, how do I get volume on this?
Heather, do you know how to do that? I'm not.
Yeah, there should be a way to share when you share your screen to also share your sound.
Oh yeah, there's a little checkbox in the corner on the share screen. It says share sound.
Okay, hang on a minute. I'm going to pull that up. Thank you. Share screen. How come I don't see share sound? Sorry.
In the left-hand corner, there should be a little share sound checkbox you can check.
Unfortunately, it's not.
Do you have a link to it? Maybe I can share it.
Yeah, I think we'll just, if people just can watch, I mean, this is the outcomes, though that's not a very pretty picture, but hopefully.
Can you share your screen again?
Yeah, oh, sorry. Yep, I will try that one more time. Here we go. Oops, of course, there it's not showing, so bear 1 second, and if it doesn't work, we'll should have younger people doing this than me.
Agreed. Me too.
You're doing great, Todd. You're doing great.
Thanks. All right. Can you see it now?
Yes.
All right. So this is some of our instructors. You can see the.
Yeah, that's awesome.
Lots of improvised, what do you do with very low resources, wound cleaning, using cardboard sticks, tarps. All right, I'm going to cut that out just because I think we've seen enough there. So how do I do our share screen? Stop share. There we go. All right. Oops. No, I want to go back to share, of course. All right. All right. Can you see my screen now?
Nope, we see you, but
my apologies.
That's okay.
Share screen. Come on, Todd. There we go. Share. All right. How's that?
Good.
All right. So just some public health implications. We enhanced resilience by preparing laypersons to deliver the training. We added to, we believe, the robustness, redundancy, and rapidity of response, which I think, in particular, the rapidity is really important here. And we not just theorized, but we got to implement and test. One of the exciting things for me was that we taught 2 classes, or I shouldn't say our local experts taught 2 classes. I was just behind the scenes coaching. The first class, the average evaluation was a 9.3 out of 10, which was amazing. But even more impressive was by the second class, the next day, the instructors had, we reviewed, we reflected, and they ended up with a 9.7 out of 10 average evaluation from the participants on the class, on the value of the class. So it was really impressive to see how just a little bit of practice, they got even better. So we're very pleased with what went on, and just lots of acknowledgments, and I'll stop here.
That was wonderful, Todd. Thank you so much. Now we are going to hear from the team led by Jasmine, and their project is called Improving Disaster Information and Communication Technology through Co-Design and Tabletop Exercises. Okay, there's Jasmine.
All right.
Is it Jasmine or Jasmine? Oh, I think I did the Spanish pronunciation.
Whatever people like.
Okay. Thank you
All
so
right,
much.
here we go. So good afternoon, everyone. My name is Jasmine Cheen. I am the co-founder and director of Replus Collective, and I'm here to represent our team and also our research collaborators, Jonathan Suri from Columbia University and Robert Soden from University of Toronto, as well as our community partners in Puerto Rico, to share with you our process findings and lessons learned from co-designing tabletop exercise to improve disaster information and communication technology with the support from Natural Hazard Center. And before I dive into the research projects, I'd like to introduce the information communication technology platform, Replus Connect, that underlies all of these projects. So our project really started in response to the information, accountability, and collaboration gaps among residents, community groups, and disaster management agencies in the wake of Hurricane Maria in Puerto Rico. And Replus Connect is a platform that integrates mobile and web applications, data intelligence, and social infrastructure to connect residents, community groups, and disaster management and aid agencies to direct the right responses to the right places at the right time. So throughout our research projects, so with the platform, our intended goals are for community residents to use the mobile application to crowdsource community information and also to support community disaster management activities. And for the community groups, meaning resident associations and church groups and the alike, they will recruit and support residents to become what we call community ambassadors with the agencies to help deliver essential resources and services to the affected populations. And then with the disaster management agencies, they will utilize the software to integrate community knowledge and information into their resource and service allocation and distribution, planning and coordination processes with the local community groups. So in 2021, in response to the constraints from the pandemic and also the reoccurring issues as a result of the physical distance for remote or underserved communities, we set out to design the process of crowdsourcing using the cultural probe method. The cultural probe methods are often used by design researchers to collect information about the perspectives, daily lives, and desires of diverse participants. And our original project showed a very strong desire from our community partners, governments, and other organizations to participate in a very collaborative planning process. And it also has proven to be a very effective method to gather very rich information to be used to enhance disaster planning, especially in the limited resource settings. And it also became even clearer that community leaders really serve a very valuable role as health educators, trusted communicators, and also emergent responders to meet the growing needs of communities after compounding crises, especially in the wake of a threat in terms of infrastructure safety. However, what we've learned is that it takes considerable amount of time and effort and also very focused expertise to be able to evaluate the results from cultural probes in order to provide actionable insights. So for us to continue fostering community collaboration and planning through our research and product development process, we came to the idea of using tabletop exercise. these exercises can help gain insight into how a data-driven tool such as Connect can be effective, can be effectively utilized in low resource settings to meet the diverse needs of a community and different stakeholders. So we collaborated with residents, community-based organizations, and humanitarian aid agencies at the municipal level to design and host community-based tabletop exercise. And the overall purpose of these exercises was to improve the design of Connect in its 3 pillars to support community needs and also situational awareness, especially around the mass care and shelter planning and management during disasters. And so specifically for the software, we hope to be able to improve the design to ensure that the software is reliable, user-friendly, and accessible. Under the social infrastructure pillar, in terms of connecting the different stakeholders, we hope that it can foster more inclusive collaboration. And also under the data pillar, that we look for Connect to lead to more equitable and also effective resource allocation distribution decisions. So these 3 groups from Loiza, Lajas, and Ponce, we had been collaborating with them for several years. And during this particular project, they participated in the co-design sessions, and they also participated and completed all the administrative and IRB process. They recruited 2 community leaders, 5 residents, and also 2 municipal representatives to participate in the exercise. And they also helped us secure and prepare the venue and other logistics support. So we had a multi-step process to co-design this whole process. We first started collaborating with CBO to make sure that we have our research goals, agenda, and logistics aligned. And then our research team, we integrated both the Homeland Security HCEP principles as well as design research to prepare for the co-design sessions with CBOs. And then we hosted 3 different co-design sessions to develop and also refine the different aspects of the tabletop exercise. And during this process, our partners recruited the different participants based on co-design standards. And so with some of the work outputs that came out of these are presentations to lead these co-design processes, as well as exercise materials in its various iterations. And then in May, we conducted 1 table exercise in each of the 3 communities. We also made modifications of the workshop materials based on feedback from the previous workshops. And then we reviewed, annotated, and analyzed notes and transcripts from all of the workshops and prepared the report. And now we're in the process of reporting findings with peers and also our workshop participants. So here I'm sharing with you all some of the materials that came out of the exercise. For example, we had an introduction presentation sharing with them, clarifying the goals, the assumptions, and the scenario, which we had 2 parts. One is before the hurricane season during the preparation phase, as well as 2 weeks after the hurricane's landfall, where we ask community and municipalities and residents to allocate resources to meet the needs of individual and households. We also prepared these workshop discussion and activity guides. We also created mock data tables at the household and community, and also at the individuals that are acting as community ambassadors. We also created profiles for the roles that the participants take on. We also created debrief and feedback form, both on their tabletop experience as well as their evaluation on the product that we're building together. So at the end, we had 25 participants across three-hour sessions in 3 communities. Throughout these exercises, the participants worked on setting priority populations for the different resources. We had generators and water. We also asked them to see how they're making allocation decisions, both at the municipal level and also how they're allocating resources to households and individuals. And also we asked how community groups are assigning roles and tasks among the resident community ambassadors. So based on the results from our post-tabletop exercise surveys, we really saw that participants had overwhelmingly positive responses and experiences, and many of them expressed their desire to have more workshops in their communities and municipalities. And they also held very strong beliefs that residents, community groups, and disaster management agencies can really benefit from the tool. So what you're seeing here is what their thoughts on the tool's potential to benefit residents, and what they thought the most important ones are to increase residents' awareness of the needs and the different measures, and to increase civic engagement activities, and to increase access to resources and services, and also to improve their access to participation in the decision-making process. While for the different organizations, both at the community level and also at the municipality level, they also thought that it has great potential, especially around improved disaster management and planning with access to community information and decision-making support, and also with access to greater funding and resources, and also a more equitable and effective resource allocation and distribution process. And also, this is kind of as it being part of a bigger research and product development part, just to share with you a bit more additional work that we're doing. So this is the scanning of the exercise material and the scripts from the workshops. We then analyze and organize them in different tools, including Mural. And then we organize all the different observations by theme, and also came up with some preliminary insights that we'll continue to take into our next stage of product development. Some of the really high-level snapshots of what we've learned is that, and also confirmed a lot of our assumption, is that the different data users, residents, community groups, and municipality agencies, they have different requirements for how granular the information that they need. And also, depending on what community, they have a quite intricate and complex combination of factors that they consider, and also the processes that they use. And also we see that there's a pretty obvious gap between communities and municipalities, how they're making their decisions. And the last part is that we definitely found the tabletop exercise and the design processes to be a really valuable experience for our team and for our partners and the different participants. And I think the parts that worked really well included that we had really close collaboration with partners, designing all the different aspects from the very beginning, making sure that it's appropriate to the context and sensitive to the post-disaster condition, also useful for the partners and participants. We also pilot tested and did agile iterative development process, for example, that we updated the different aspects as we complete each exercise. And also we've been having long-term collaboration with our community partner, making sure that we're really building something that they want, and also to ensure mutual trust in the process. And then this also has been a pretty challenging project for us, as we see we had a very ambitious goals. And also this was, for some of the team members, it was the first time designing a tabletop exercise, but we also made sure that as we also integrate the different methodologies. And the second part is that as the project itself is a digital project, but for the exercise, we had to work to translate the designs into analog forms while preserving the content and some of the functionalities to allow participants to be able to use that. And the third part is that we had to adapt really quickly due to changes in the logistic part. For example, there were more or less participants that might show up, and also some of the tasks would take longer or shorter depending on how they progressed. And lastly, we'd like to thank our community partners, residents, and representatives from Ponce, Loíza, and Lajas, and also to Natural Hazard Center for your continued support. And thank you everyone for your time, and love to hear your thoughts and questions. And also the last part is that, as I mentioned before, this is a long-term project, so we will continue to integrate the insights and findings and lessons into our future development processes. And with that, thank you.
Thank you, Jasmine. That was wonderful. And it's so exciting to see all of these projects advancing and developing these tools for people to use. I dropped in the chat all of the links to the briefs, so you can get all of the information about the projects there, and also read about the different products that the teams developed for this continuation award. So now we have, believe it or not, we have 23 minutes for discussion, which that's a lot of time. So great job, everyone, keeping on track. So let's see here. I think I don't actually see the raise hand feature. So I'm just going to say, if you have a question or would like to discuss something, just go ahead and come off mute and ask your question. We're open.
Megan, real fast, if it's okay. The raise your hand feature is under the reactions where you see the little.
Is it there? Okay, use that one. Well, thank you. Oh, I see it. Okay. So yeah, you can use the raise your hand feature, or you can come off mute since we're a pretty small group. Jonathan, I see you are off mute. Do you want to ask a question?
Hi, folks. Can you hear me?
Oh, I can hear you.
Yeah, my internet's been terrible today, so I apologize if I cut out at any point. I had a couple of questions. One for Todd's group and their presentation. Have there been any other additional trainings that have been conducted after the TOT and the 2 trainings? And what have been the results of those?
You're on mute, Todd. Can you? There you go.
All right. There we go. Yeah, thanks for the question. There was one planned, and typhoon delayed that. And I believe it has been rescheduled, but to be honest, I'm not sure. I'm back in New York, and it's a long way away. So the day-to-day stuff I have largely turned over to our colleagues in the CNMI for running those. And then again, we were excited to get the query from the Center for Excellence in Developmental Disabilities to adapt the curriculum in yet another way to serve the needs of those with developmental disabilities. So excited about that.
Thank you so much. And then one question for the RE+ folks, and I apologize if I missed this. There might have been my internet cutting out, but I couldn't see anything on the brief either. Was there a particular model that you used for sort of the co-design work, like human-centered design or something like that?
Was there a particular kind of, what do you mean when you say
like
model?
Like a framework or for how you would go about obtaining the input and working with that input from community members.
Yeah, we combined definitely principles from the HCEP, the tabletop, the exercise that Jonathan can talk more about. And on our side, I think it's a kind of a general participatory, ethnographic centric process where there wasn't a very rigorous kind of like a set model that we were using, but it's a lot of the human-centered design principles, a lot of design justice principles, and kind of a combination of different, making different processes, making sure that we're listening to the different stakeholders, and also being able to analyze and understand what we've heard with the support of kind of analytical processes using both graphic tools and transcripts and kind of finding patterns. And we have a combination, pretty much everything that's possible available to us out there.
Fantastic. Thank you so much.
Thank you.
Jasmine, I've got a question, and I apologize if I missed it. Who are your workshop participants, and how did you recruit them? It seems like that's at least from our work, that was sometimes a challenge trying to recruit, particularly laypersons, folks that didn't have a vocational connection to disaster or emergency medicine.
Right. So for this, we really have to thank our community leaders. So the three groups that they're community-based organizations, they're grounded in their communities and they have connections to their residents. But we collectively, both the research team and also the community leaders, came up with the standards, kind of the criteria for selecting the right participants. We looked at like the gender balance and age and kind of their experience in working in disaster management or the lack thereof. And also part of the research grants and throughout our process has always gone to support these community leaders for them to do this kind of work of going out there and recruiting participants and securing venues and all of that.
Thanks.
Yeah.
Great. I had a question for Anna. Anna, are you still there? I was wondering, you guys were talking about how you just had this overwhelming demand for the webinars, and I was just, partially wondering how you managed all that overwhelming demand, and then your idea about developing this into an annual series. I was wondering if you could talk a little bit more about what plans you have in motion as far as, how you're going to move this forward.
Well, actually, what we had to do was just allow registrations at the last minute. We accepted them. We were offering, when we recruited the agencies, we sent flyers out to them advertising the webinar series, and we had people register, but then the morning of, like I said, each morning was like this overwhelming response. People were still registering. We offered gift cards for their attendance, and we did prizes and giveaways throughout, asking questions. After each presenter, we had a question, the first person to respond with the correct answer, kind of thing. We have not really thought about continuing, how we're going to continue this. That's something that we're going to visit after this meeting, because honestly, we thought about it and we're thinking, like how are we going to be able to do this, how we're going to be able to manage and offer additional series on an annual basis. So it's something that we're going to, give some thought to and see how we can do it.
That's wonderful. It sounds like. Go ahead, Kenny. Sorry.
Yeah, we've been tossing and turning because we've had a number of agencies and departments, HR directors that have contacted us. So we're in the process of thinking of ways where we can continue to communicate with them and come up with webinars on a regular basis, similar to because it was really like Dr. Clark was saying, it was really successful, and we have the support from the department heads and agencies. So we want to continue with this experience.
That's wonderful. Thank you. I have some other questions too. I had a question for Todd, who mentioned that the importance, like how vital it is to have community partners. And I think every group can answer this, but I wanted Todd to go first since you mentioned how important that was. What tips or recommendations do you have for other people who are interested in developing these types of community partnerships? Where should you start? But how do you get those things working? You're on mute though.
Initially casting a wide net, just a Google search of names that pop up in the geographic area in which one's interested, that helped. And then I must have sent out 20 queries to individuals and offices inquiring about an interest in partnering. And the College of the Northern Marianas was they jumped on it. And I think finding a local champion who really believes in the cause, in the research, in the efforts makes a huge difference. So we had colleagues that were just as animated and interested and engaged as I was, and often more so. It's their own backyard. Made a huge difference. I think that's casting a wide net, and then hopefully finding a champion. Those two things worked, at least for us in this.
Wonderful. Jerry gave you a heart for that one. Jerry, I don't know if you want to come up and talk about your experience working with Todd too, since you are one of the very important partners.
Well, thank you. Thank you, everybody, for the opportunity. I just want to express just a huge thanks to Todd and, just this entire group for just looking, at the marginalized islands. Saipan, as Todd said, is part of the Northern Marianas, and we are so isolated. So very, very grateful to have an expert come and train. And granted, we do have our own folks in emergency preparedness, and we do have so many partners in the community, but just Todd coming out and being willing and carving out that time to train our lay people just means so much. So like Todd mentioned, just here last month, we had Typhoon Mawar, and it really hit Guam, which is to the south of us. And then one other island, Rota, was hit pretty badly. Saipan was saved for this time around, but as you all know, we're in that El Nino year, and they are anticipating much worse storms. And so I feel that, as a local, that the community feels, we are resilient, but we definitely feel like we have more tools just so that we can help one another, and just know that we've got the knowledge, better knowledge now, to just help our neighbors, and not to have to wait days and sometimes weeks for assistance from the federal government. So truly appreciate the funding that was set aside so that this study could be made, and just wonderful that we are being seen and heard, and the acknowledgement that Saipan is more than a dot on the global map. So thank you, everybody, for just reaching out and caring for this community that I love so dearly. Thank you.
Thank you, Jerry. That was wonderful. Thank you so much. Does anyone else, Jasmine, do you want to talk about, you guys have been doing this project for a long time, developing these community partnerships. I wondered if you wanted to, I know you talked quite a bit about that in your presentation, but any other advice you have for other teams that might be interested in doing what you're doing?
Yeah, I think a lot of this really came from it took a long time to be building relationships with them and keep in contact and keep the promises and going back and check in with them, deliver what we promise, and then also share resources, and don't take it for granted for their participation, their knowledge, and their time. And also understand that some of the challenges between kind of the community groups and the municipalities, there are like existing kind of complex history there. And some of that, like, we are there to observe and learn and understand. And sometimes kind of the great part, sometimes we see that with our participation, sometimes coming from outside of Puerto Rico, that we're building new bridges, and see that process happening is also really wonderful. But I think at the end of the day, we're there to learn, to facilitate, and be good collaborators and good friends a lot of times, that you would have to start from there. So
I love that. That's wonderful. Thank you, Jasmine. Okay, Anna, I don't know if you want to talk to, you had a little bit of a different process because you also have been doing this project long term, but you kind of reached out and developed partnerships with experts in burnout. I wondered if you wanted to talk a little bit about how you reached out that way and developed those types of partnerships with experts in fields that weren't necessarily your area of expertise to begin with.
What we did was look at people who could, well, it didn't need to necessarily be in a particular field, but presenters who basically presented in different spaces relative to emotional well-being, of emotional wellness, stress, burnout. And so a lot of the presenters that we and agencies that we built partnerships with to put the webinar on were social workers or like marriage and family therapists, some educators within the field of sociology, social work, psychology. Individuals in those different fields.
And we also, and one of the great things about working at the University of Virginia is that we have a wealth of not just the knowledge, but we have a wealth of practitioners and professionals and expertise in the area. So it was kind of interesting, drawing from psychology, drawing from social work department, drawing from that we have the expert. And the great thing about it is that now the departments are looking at the University of Virginia for that expertise. Seeing that we're the only university in the Virgin Islands, so we're bringing a connection between the University of the Virgin Islands and what we have to offer as to the Virgin Islands and our community. So I think it was a really good experience, a way for us to really showcase what we have at the University of the Virgin Islands.
Oh, that's great. Yeah, I love that because you're building those bridges outside of the university to the.
Exactly. Yeah. It's not we're not just educators, but we have so much knowledge and expertise that we can share with the community. So it was a really good blending and mix.
Yeah, it sounds like such an exciting project that you really do have a lot of opportunities to keep growing it. So we're really excited about everything that all three of these groups are doing to see what happens next. So let's see, how much time do we have? We have about 7 more minutes. I don't know. I was going to ask for our own benefit, as this is the first time that we've ever done the continuation award, and first time we've ever done this type of track, community engagement track. I was wondering if you guys would like to give us some feedback about your experience, what we might be able to do better, anything you want to give us feedback as far as how it's been going for you as we think about this program going forward. I'll let
I just want to say thank you for this, because this was an opportunity for us to take the research that we originally did and give back to the community, and we found something, and so now we're able to provide them with the tools that was needed. And you should, Dr. Clark really talked about it, but the response that we got from not just the managers and administrators, but from the frontline workers, the stories that they told us, the things, and we offered them some interesting, training. I think the topics were interesting and the communication. So just want to say thank you all for this. This was a great opportunity again. And it's kind of like paying back to, the help. When they provided us with their perceptions of burnout and their feelings, that we're able to help provide them with a service. So yeah, thank you.
Thank you, Kenny. Yeah, that was just exactly what we were hoping that this program would be able to accomplish. Thanks. Do you want to go ahead, Todd? I see you nodding your head over there.
Yeah, thanks, Megan. Yeah, no, I would just reiterate what Kenny said. I think there's always that tension between results and time, and even the continuation felt like we were a little rushed, and we might have been able to do a better job had we had a little more time to develop the proposal and to implement. I don't know where that balance lies with getting things done, and you give us enough rope, we'll hang ourselves higher, but there's a bit of a struggle there, but I see you nodding your head. You recognize that. Yeah.
We know it's a challenge, and every year we're like, we need to give you all more time, and that was part of the reason we developed the continuation award. We're still working on figuring out ways to kind of make the project, because we know we're pushing a lot on you in a very short amount of time, and so like, how do we balance it out so that it's feasible? Is something.
Yeah, but the principle of continuation award is brilliant, and again, I think made a heck of a lot of difference in the Northern Marianas. And so we're most appreciative for that opportunity.
Thank you. Okay, Jasmine, did you have anything you wanted to add?
Yeah, we really appreciate the opportunity as we are working on this process. It's a long-term project, and we felt like the last one we had a lot of really great findings, but there was never enough time. There will never be enough time, right, to continue and to do more. And so with this opportunity to kind of do a step further based on the exploration and discovery that we found through these analog process, it's really helpful. And I think for us that it was the first time that we really kind of prototyped our digital process into an analog form and really watched people use our tool is really, really helpful. I think one of the most helpful processes that our development process has gone through. So we really love that. But also it's very stressful. There's a lot of things that we're trying to complete in a very short amount of time. But yeah, it's really great to continue working with the same partners. And as we were saying before, of continue building that trust and showing them that we're not doing it one time and we're going to leave. We will come back and we'll continue to do this project when we care about this. So that was really helpful to support us. So thank you.
Great. Thank you so much, Jasmine. And thank you so much, all of the teams that work so hard. And I know you're still working really hard because there's a lot of things that you're still pushing forward. We're actually at time. And so unless anyone else has another question, I'm going to let us go about a minute early. But thank you again so much for being here. And please, reach out to us at the Natural Hazard Center. We're always open to hearing more ideas about what you are working on. We want to hear about your next steps and see if we can keep, helping push your work forward. So thank you again for all that you do and have a wonderful rest of your day.